Good morning, everyone, and thank you for joining us this morning for this forum. This forum is really for physical therapists in general, but especially for private practice owners. First of all, let me say that this event is sponsored by Hands-On Diagnostics, Hands-On Seminars, and TelePT4me.com. And I would like to thank the sponsors, but also I want to tell you that when we were thinking on how we would put this together, the information about the medical aspect of coronavirus, the management, the vaccines and all that, it is so rapid and there is so much information out there, especially from CDC, that we believe that it would be beyond the scope of this forum to just tell you the medical aspect of it. Instead, we want to spend all the time we have to provide to you solutions that can help you mitigate the risk and come ahead for your practices. I would like to get a sense of who is attending really this event. So I am asking you just to answer real quick these questions. Are you a private practice owner? Please answer yes or no. Then the next question would be, did you have to let go of any staff? If you had to calculate the negative effect of COVID-19 has had in your practice, how much of a negative effect have you experienced thus far? Okay, so the votes are coming in, and I will let you know that we have right now about 60. Okay, it gives us actually time, I think. Okay, so 72% of you have voted already. 81% are private practice owners. 50% of you had to let of staff go. 4% had an effect of 0 to 20%. 31% of you had an effect, a negative effect of 20 to 40%. 28% of you had a 40 to 60% negative effect, and 37% had a negative effect of more than 60%. So I'm gonna share the results so you guys can see how this is affecting practices. Yeah, indeed, this has been a problem for most of the practices around the country. Sharing from our own practice, it was very, very difficult to have to let go of 14 staff members a couple of days ago, and pretty much convert a lot of people to part-time and hourly. Well, here is the point though, and before we start with the various presenters, I want to show you a little bit of my take on this and what I think we should be looking at. Here is this slide. I am going to, you can see my screen, right? Somebody say yes?
Yes.
Yes.
Good, thank you. So if we don't take any action, if we have a practice, let's say, that brings in $100,000 a week, a month, a year, it doesn't matter. Let's say you have a practice that brings in $100,000. If you do nothing about it, by the end of the situation we have with the coronavirus, you're going to be down, let's say, to $50,000, or you know what? Maybe even to zero in some situations, if in your specific region, they shut you down. So, and what's going to happen when everything is done, you're going to start recovering, but your path to recovery will be very slow. Maybe if you were completely shut down, maybe in 30 days, you're going to have 5,000 and 15,000. So you will very slowly start creeping up into regaining momentum. And it is even possible that you may not reach your previous state of business. That is if you do nothing. But there is always something that can be done about it. So here is what I'm saying. If you implement right now mitigation strategies for this risk, no matter what, you will not get to zero. Maybe your business will go from 100,000 to 70,000, but you see your recovery will be much faster and you will speed up ahead of the game. And maybe perhaps after a year, you're going to reach a much, much greater state of business than you were even before coronavirus. So this is the message that I want to give right here, right now to all of you, that if we do nothing about it, well, guess what? We become the effect of the situation. We are the effect of this virus, and you know, sorry the expression, God damn it, we are not going to allow that to happen. We will be proactive and we are going to do something about it. And this is why we have brought together today 14 panelists that will help you get solutions in all areas of your practice, from insurance to financial strategies to compliance, to telehealth, to putting in diagnostics, other solutions that some of the panelists will offer. And we have some of you who are PTs, you'll describe to us what have you done already and how you are dealing with this situation, and marketing, of course. All right, so with no further delay, I am going to introduce first Mary Dolong and Alicia and Teresa, who are going to discuss with us compliance, which is one of the very important things to implement in a practice. So please ask your questions from time to time. You can type them. From time to time, we may interrupt Mary to ask her the questions that you are asking. So Mary, you are on.
Thank you, Demi. And can you see my screen?
Yes, but right now it's in it's not in the presentation mode.
Okay. Let's get that in there. Okay.
Just hit slideshow. There you go.
There we go. Yeah, it's going. There we are. Okay. Well, good morning, everyone from Houston, Texas. And Demi, thank you for inviting me to be on this panel. When he said we're going to provide some solutions, I always can look at people's faces and they're going, yeah, compliance is not a solution, but it really is. We want to keep you out of trouble. One of the things that we have done, we have the slides obviously for this presentation, but we have added bonus material. One is a video for bloodborne pathogens, which obviously is very important. It really gets down to some of the things that you might want to teach your staff. We all know bloodborne pathogens is an annual education requirement for our staff. And then there's a short segment on the coronavirus. So please take advantage of that. They're handouts, but if you do want the actual live recorded video, then please contact Alicia. And Alicia, I believe you put your contact information there. If not, we'll make sure we get it to you. So you can type in your email address and we'll go from there.
Oops, I put it, that was just.
Okay, so we're going to start out talking about Medicare, because that obviously is the big issue we deal with. Medicare was given the authority through a waiver 1135, to expand telehealth. And initially when we saw it, we were totally excited, and I don't know how to say it any better, but we were kind of fooled. So let's look at what this does. The waiver is specific to telehealth and also virtual systems. So the waiver for telehealth is for doctors, nurse practitioners, clinical psychologists, and licensed social workers. And before, telehealth was restricted to designated rural areas, and now it's not. It's anywhere, any place, anytime. So the virtual services we're talking about is telehealth visits, virtual check-ins, and e-visits. So, quick overview of telehealth. So the provider must use an interactive audio and video telecommunication system that's real time. And it connects the distant site, so the doctor, the nurse, whomever, with the patient, wherever the patient is, unless there are state laws that prohibit it. These practitioners will be paid for telehealth at the same rate as a face-to-face visit. And here's a list again. So who may do telehealth? Physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthetists, psychologists, social workers, dietitians, and nutrition professionals. You don't see PT, OT, or speech on that list, do you? Very disappointing. So we're going to virtual check-in. So this is like a brief, quick check established by a patient, but a way to communicate with their provider. And they can use a phone or any type of virtual video or imaging that they have available. This is limited to qualified healthcare practitioners who report using E&M, or evaluation and management services. You don't see PT, OT, and speech there, do you? Okay, so our e-visit does not equal telehealth. It is a virtual system. So when we have certain things that are part of this e-visit, it is from any location, so there's no geographic limitation like you have to be rural or something of that nature. It is supposed to be initiated by the patient and to have an established relationship. So this wouldn't be the initial evaluation. This would be a patient that you have had an established relationship with. It is non-face-to-face communication, so we haven't been able to bill for that before. As I said, it's supposed to be initiated by the patient, but we can educate the public and our patients. So if a patient were to call in and they want to cancel their visit, you have the opportunity then to tell them about your e-visit capability. Excuse me. So a couple of points as far as the e-visits. These e-visits are bumped into a 7-day period, so 7 consecutive days. You can tally up your time. You can only bill one time for those 7 days. So typically you're going to bill it at the 7th-day visit. The co-insurance and deductibles do apply to e-visits. However, the Office of Inspector General has stated that they would not sanction individuals under the anti-kickback statute if they discounted the co-insurance or the share part for the patient. If someone is considering that, I would advise that you look at the actual payment for the e-visits, because it's not really hefty. And if you're going to discount the co-share, then you really might have an even more negative situation. Initially, CMS said that we would not use a modifier with e-visits, but as of Thursday night or Thursday afternoon, they said we should use the CR modifier to bill these services. Now, here's where things get kind of confusing. They are very specific that e-visits should be an online patient portal. And after I really read through this, I said, my gosh, we're all using patient portals. You know, how is this a benefit? Well, the benefit is we do get to bill for it. And we also have a little latitude from the Office of Civil Rights as it relates to HIPAA violations. And I'll cover that in a little bit more. So what happens if you don't have a patient portal? You don't want to spend more money for anything right now, so you're not going to hire an IT person to develop that for you. What Medicare said is we can use some of the popular applications, video chat, Apple FaceTime, Facebook Messenger, Skype, Zoom, those types of applications, and they will not impose a penalty for using that. So it's kind of like you're supposed to use the portal, but if you don't, we're not gonna sanction you. But they are stating that you definitely need to tell the patient if for some reason the application that you use is not encrypted. You need to tell the patient that they have a vulnerability if it's not encrypted. So when we look at we are qualified healthcare professionals, they did list us. This is the first one we were listed on. Again, online assessment and management for an established patient for up to 7 days. Cumulative time. So if you spent 5 minutes on Monday and 10 minutes on Wednesday, you're going to add that time up, and at the end of the 7-day period, you would bill for that. As you can see, the 3 codes that we have run from 5 to 10 minutes for 61, 11 to 20 minutes for 62, and 21 minutes is the max. And all of us know that that's about a fourth of a visit, so that's not helping us a whole lot at this point. So one important thing to know, telehealth is still not covered by Medicare for us. And as such, we then have it as a non-covered benefit, which means we can collect cash for the services delivered through telehealth to patients that are Medicare beneficiaries. So those of you who have been treating Medicare patients via telehealth, you can continue to do so, since it is not a covered benefit. And someone did ask me, and I should have put this in the slide, you do not have to bill Medicare or use an ABN so that, bill Medicare so you get a denial, unless there were some, maybe a secondary payer. But for most, from all intents and purposes, you don't need to bill Medicare and you don't need the ABN. I typically advise people have an ABN on file so that, later on, if maybe a family member comes in and says, why did you charge my mom, my dad, or whatever for this particular service, you will have the ABN to back you up. So, Medicare coverage and HIPAA. As I said, HIPAA is going to be somewhat lenient as far as what kind of applications we use, but they definitely state Facebook Live, Twitch, and TikTok, and similar video communications that are public facing. So accessible by the public should not be used when you are dealing with healthcare providers. So, healthcare providers dealing with their patients. They state that we should make the best attempt we can to work with entities that are HIPAA compliant and will sign a business associate agreement. However, the OCR says again, if you can't get a BAA signed and you are doing this in good faith so that the patients don't have to come in or increase their risk level, they would overlook that particular situation. So the other thing that, we all know we can't offer discounts to the patient for their co-share. But what the Office of the Inspector General is stating is that they will not sanction us for reducing or waiving cost sharing for beneficiaries when we deliver these virtual services, as long as we are doing it during the time that the COVID-19 declaration is alive. So that is something to know. Again, cost sharing, make sure you know what you're being paid before you do that. So we have two other things that from the waiver that are beneficial to us. One of them allows therapists to work in a different state, even though they're not licensed in that state and not enrolled in Medicare in that state. So they will allow us to do that. Now, and it applies to both Medicare and Medicaid. So the second one is provider enrollment, and this one is really good, but depending upon looking at the survey Demi just did, and you're laying off staff, you're probably not running to hire staff at this moment. But basically what they're going to do is they're going to create a hotline, and we'll do a enrollment of practitioners, and they get a temporary Medicare billing privileges. They also, for those that like PTs in private practice, we have to go through a site visit when we add staff and we change locations, that type of thing. They're going to put a hold on those. The criminal background checks, they are putting a hold on, so they're really trying to focus on things that are of more value. And the application fee for new enrollees really applies to rehab agencies, not to PTs in private practice. They are going to postpone revalidation. They will also expedite any pending applications from providers for Medicare enrollment.
Mary,
yeah.
one quick question before you go to other regulations.
Sure.
Some people are asking, because obviously the reimbursement for this physical therapy visit, as you described it, in essence,
the e-visit.
The e-visit, in essence, the maximum reimbursement that somebody can get for the entirety of the number of visits that they will do would be only like $35, right? Something like
correct.
that. Correct.
That's correct.
So I'm getting and this is because it is not a real telehealth visit. It's not a real PT visit. It's this e-visit.
It's not telehealth.
It's not
right.
telemedicine, yes. So the question we've been asked by one of the attendees is, in states where a physical therapist can collaborate with a physician, or in states where a physical therapist can hire a physician, can a physical therapist do that in order to bill full visits under the physician rather than e-visits?
Yes, that would be possible. I actually have a reference on that, and when I will look that one up when I'm finished presenting, so that we can give you the reference that explains that particular situation.
Okay.
Anything else? Okay. So we do, obviously, OSHA is alive and well. And the main thing that applies to COVID-19 is the use of personal protective equipment. So we're looking at gloves, eye and face protection, respiratory protection. To the best of my knowledge, everybody is short on PPE, and now we're having declarations by various governors to disallow us from our access to discontinue treating patients, so we won't use the PPE that needs to go to the first responders. But that is one of the things that OSHA would require, so that you would be in compliance with taking care of your employees. Obviously, we have a requirement and our professional ethics and license to take care of our patients, but OSHA takes care of employees. And so if you don't have those available for your employees and there is a risk of exposure, then you possibly could be subject to violating OSHA's bloodborne pathogen standard as it relates to PPE. OSHA is giving some, again, latitude, like all of the agencies are, as to what kind of face mask you can use. The N95 is just the gold standard, and that's something we should have in our clinics under normal circumstances. But they are talking about other types of face masks that could be used, and also waiving the mandatory fit test for the N95. So, types of bloodborne pathogens, we have exposure barriers, and it's PPE is the biggie, engineering and work practice controls, housekeeping, and also education of your staff. And that is why we have that bloodborne pathogens bonus material for you, so you can educate your staff. So the PPE examples, I just stated what they are. And for sure, your regular work clothes are not considered PPE. So in a situation where you could be exposed, you should wear a gown, or those clothes cannot be, you shouldn't go back into the public or home. A doctor from Harvard was on the news yesterday, and he said, I'm having to wash my mask. He said, I have a bucket of disinfectant, I wash my mask, I strip in the garage, I don't talk to anyone, I don't smile, I don't do anything till I scrub down. So they are in very dire need of our PPE, and that makes us even more vulnerable if we don't have it, and we need to make sure that we take care of our employees. Engineering and work practice control, hand washing, we talked about that, hand sanitizing, putting things in the right place. So normally you would not put paper into a biohazard bag, but if you have someone coughing and the tissue is saturated, or anything that is being used that could be contaminated by the virus, I would highly recommend you put it in a red bag. It should be properly labeled, but again, I'm sure they will waive that particular requirement. You want to make sure that you don't just put it in regular trash and someone handles it. And your housekeeping practices, again, have to be intensified. This is just a list of the things that they talk about as far as housekeeping. The CDC level disinfectant typically is tuberculocidal or hepatitis B level disinfectant, but they are saying that under normal circumstances, just household cleaners will do the trick. You want to make sure you adhere to the dry time, because if you put it on and you immediately take it off, it probably has no kill time. Hazard communication standards, this again is a requirement for us. And the thing that just kind of popped into my mind when I was doing this is we're using every type of disinfectant we can get our hands on if we didn't have the supply available. And so you want to make sure in all your spare time that you update your safety data sheet and that those particular products are properly labeled using the pictogram requirement. So look back and see if these are new items that replaced what you had previously but run out of. Make sure you have those listed on your hazardous materials list. I think I just said this too
Mary,
much.
one quick second, if I may interject for a second. Those of you who are attending and who have friends who are trying to get on the Zoom meeting right now, according to Zoom, despite the fact that we have purchased 500 seats, they have locked us up to 123. So they are not allowing right now any more people to come onto Zoom. However, right now we're transmitting on Facebook Live. So you can tell your friends if they go to Facebook Live and send me a friend request under Dimitrios Kostopoulos. I'll spell my name on the chat. They can watch it on Facebook Live. All right. And maybe you guys can share it.
You are recording too, right?
We are recording also to send it to people who will miss it. Absolutely.
Mary, before you go on, we've got a couple of questions that just are timely with this. People are asking specifically, about PPE, which ones were required, what they were supposed to have in place. If somebody does not understand this regulation, we're happy to explain this offline. You can certainly email me, Alicia Mahoney, and I will post my email address later. This is something you should have already had in place. You should have PPE supplies. We understand that right now getting them is going to be tough. But the masks, gloves, and gowns are the three main ones that should be in your practice right now. Right now, Mary, somebody has asked, should staff be wearing masks and gloves?
I'm sorry, to do what?
Should staff be wearing masks and gloves?
Okay, that's a $1-million question. I would tell you to wear gloves. I don't know where you're going to get masks, but we do know of 2 situations in which staff have contaminated or passed on the virus to patients, or at least exposed them. There's 2 PTs out there that we know of who have the virus. They have tested positive and they treated patients before the symptoms were fully manifested. So if you could, yes, that's all I can say. You certainly want to use gloves if you can. Those are at a premium. I think most of the stores, I went into CVS yesterday and they had a table and they said paper towels, tea paper, gloves, and disinfectant. You may have 1 of this one, 2 of that one, 1 of this one. So they are rationing how much you can buy. But if you can get your hands or you have supplied gloves, I would tell you to wear them because you don't know if somebody's in the early stages of the disease. Okay. This is something that you really do need to be aware of. Under the bloodborne pathogen standard and HAZCOM standard, we have to report anything that is any major problem that is work-related. So if someone on your staff contracted the disease from maybe a patient, or maybe it was community-based, but not something from work, you wouldn't have to report that. But if it's work-related, if it is an injury or illness that causes them to miss work, restricted from work, that type of thing, those all have to be recorded. Anything that requires medical treatment beyond first aid. And there's special recording criteria for needle sticks. Now, we're not going to be using needles with these patients in most cases, but you want to make certain that you understand what record keeping is. This is not the OSHA 200 or 300 form. These are separate records. We are, as outpatient therapy providers, part of the partially exempt industry, which means we don't have to complete the OSHA 200 or 300 form unless OSHA, and maybe Cal OSHA, requires you to because of a special notation or something. So we definitely want to make sure that you record things that are serious, just as the previous slide, but you do not have to use the OSHA 200 and 300 form. So we still have labor laws, and I want to turn this over to Teresa. Are you able to come on, Teresa?
Sure. Can you leave your screen share up though?
Yes, you can't see it?
Yeah, but I'm not going to share my screen, so I just want to make sure you leave the slides up.
Right, I'll move it.
So just a couple of quick labor law things that apply as people are thinking through the compliance part. All of the regular labor laws that have been in place for an age still apply. So the Fair Labor Standards Act, which talks about minimum wage, exempt, non-exempt, overtime, all of that is still in place. FMLA still applies. All the EEO laws still apply, so anti-discrimination, ADA, etc. All the protections that have been in place for an age for nursing moms under ACA. And then obviously the Fair Credit Reporting Act still covers background checks, credit reports, and everything if you were doing that for new staff. So just kind of a reminder that there is no waiver for any of these so that you don't forget as you're working with your staff that all of these laws still apply.
May I say something, Teresa? I have entertained a number of calls from people who are trying to think out of the box. The staff comes together and they say, we don't want anybody to lose their job, so can we all take a reduction in pay? And do you see that being a problem, Teresa?
I do not. You want to think about how you're doing the reduction in pay. So if you're not doing it across the board for everyone, then you do want to have some set defined criteria so you can explain how you made that choice. So you're not looking at a disparate impact to a protected group. A lot of people use the traditional, the newest hired or the first ones to be reduced. And that's fine to do. You just want to make sure that your criteria are set and you've picked a method that you're applying consistently across the board. You also do want to put it in writing so people know that it's, due to the pandemic, we are making a reduction. Then they can also use that documentation typically to apply for unemployment. Most states will do unemployment for even people that are working a reduced schedule to cover that piece that they've lost. So, that's an advantage for your staff as well, that they can pick up the extra income from the state typically. So all the states vary, but you need to look at your states for that.
And so the other thing that's being proposed is people are looking at exempt status, and we've uncovered a nasty little activity, I guess. PTAs are not exempt by law. They would possibly be considered under professional exemption classification, but they cannot be because they do not have independent decision-making by license. So if you have PTAs who are exempt, you're going to have to deal with the non-exempt conversion. And this is where it's coming up because do you have to pay non-exempt people for days not or in time not worked? No. And in certain circumstances, and Teresa, you could expand on that, we do have to pay exempt people for all the time. I'll let you explain it. All the time that they work, if, for instance, if they work a partial day, they have to be paid in full for that day. But if they don't work any time in a week, do they have to be paid, Teresa?
So exempt and non-exempt are federally defined classifications for employees. And you do want to look at how your employees are classed. PTAs, unless they have additional job duties where they have some sort of supervisory capacity or some other, generally do not meet the exception to be considered exempt. So if you have that situation and you need more information, please email me. Alicia can post my email in the chat for everybody. If you have that specific situation, need some more information, I can talk to you guys about that offline. Exempt staff. For exempt staff, they are owed their full salary for a week if they work any part of a work week. So if they work an hour on Monday and you decide that they started at 8 a.m. and you closed the clinic at 9 a.m. and you decided that that's it, we're not going to have anybody else here, they're still owed their full salary for that whole week. If they work 0 hours in a week, then they are not owed their salary for that week. But the exempt also then, on the flip side, if they worked 65 hours in a week, they're still just paid their regular salary, whether they worked an hour or 65 hours. So
Thank you.
be mindful if you're working exempt staff a part of any week, they are owed their whole salary for that week, unless you have done something in writing to reduce their salary. So if you said we're taking a 25% reduction across the board for all staff and put that in writing and said effective Monday 3/23, your new salary will be X, which is 25% under your current salary, then that's their new salary for that week going forward.
There is a quick question here, two questions actually, one for me, one of the other attendees. Can you convert an employee who is full-time to a part-time hourly employee? That's one question.
Okay. So you can, it would need to be in writing, and there would be, you'd have to look at what they were doing. Were you converting to an hourly? If they're professional, is it how you were converting them to, like, is it per patient, you know, how, what that conversion looks like?
Per hour, hourly, per hour work.
There are some specific criteria that govern that. So you'd have to look at it kind of on a case-by-case basis to make sure that you were meeting all the criteria that applied to do that.
Okay.
So there's not just a blanket yes or no per se.
Okay. And the other question that was asked by one of the attendees is, if you have a situation where you put, let's say, an employee from full-time to part-time, how do you handle health insurance? And in general, during this time of crisis, how health insurance is being handled by employers at this point?
Sure. So, I mean, that's typically a business decision. Benefits, unless you're large enough for them to be mandated for your employees, you know, are just added benefit that you're choosing to offer to your staff. This is sort of an unprecedented situation. A lot of people are having to think about what business decision they're going to make for providing benefits. Are they going to continue to pay for them at a prorated amount and have the employee make up the difference? Are they going to continue to pay for them at the same level but reduce salaries to be able to cover that cost for their employees, you know, short term? What you do, however you decide, you know, that's going to be best for your practice to manage that financially. You do want to be sure that you're applying whatever decision you make consistently across the board, either by, you know, employee class or to all employees, you know, as a whole. But you don't want to pick and choose individually. I'm going to do this for this one person and this for this other person without having some sort of criteria or some sort of group that you're doing it to uniformly, because that's where it becomes an issue.
You also, don't you have COBRA available if you have to discontinue benefits because of the national disaster?
Typically, yes. Most plans do have a COBRA option. Some of them are set up differently, so I can't say that's holistically for everybody.
Okay.
And there's a question. Somebody has a question. PTs are paid a per visit rate and not salaried. So that would continue. So if their visits dropped, then their rate would drop if that's what's in their contract. So to answer that question, if that's how their payment is set up on the front end.
And you have to be very careful with anything that's per visit, because it could look like a inducement. And I'm sure that probably would be waived during this crisis, but again, keep that in mind. Teresa, I've moved to the next slide.
Okay, so I don't know if, I mean, people have probably heard parts of this, but on March 18th, they did sign into law the Family First Coronavirus Response Act. It will be effective April 2nd, so they had 15 days to put it into place. It applies to employers with under 500 employees, so small businesses primarily. It includes 2 kinds of paid leave for employees. Emergency paid sick leave, which is 80 hours, paid at 100% if the employee themselves is having to quarantine. If they are having to stay home because someone else is quarantined or they're taking care of someone else, it's paid at 2/3 of their salary. There is also the public health emergency leave, which is part of this. It is similar to FMLA. 12 weeks, job protected, paid at 2/3 of their regular salary. And it is designed if they have to stay home to take care of the children because the schools or their care facilities are closed. There are not yet a lot of details on how this is going to play out. There are tax credits to employers that are supposed to offset the cost of this on the back end. The government does have 7 days, so by 3/25, they should have some details out, and there will be a poster that you have to put up at your workplace tied to this new act. And it is also supposed to be available in 7 days on 3/25. But there's not a lot of details other than if your employees are there, they can take advantage of these 2 leaves. They are paid for by the business, and you would get that back, tax credits on the end, so they're saying. And there is no repercussion. So if someone chooses to use this leave, it's like FMLA, you can't then hold that against them for future employment if they choose to do so. They do mention a possible exemption for employers with less than 50 employees if there's adverse financial impact, but there are no details on what those criteria are or how anyone would apply for that or what they would need to qualify for that at this point available. So just kind of a heads up that this at the federal level is out there for employees that are still working or having to take off either because their kids are out of school for an extended period of time or because they are quarantining or having to be with someone who's quarantining for the 2-week period.
And we're on our last slide.
Yeah. So states also across the nation have looked at putting some pieces into place to protect employees as well. A vast majority of them have waived the waiting period for unemployment benefits. So for people applying for unemployment, usually there's a 1 or 2 week waiting period before benefits kick in. Most of the states are in the process of waiving that. Some already have, so that they don't have to wait. If your employees have to apply for unemployment, they get benefits immediately. Several of the states, and I've seen it mentioned a couple places, but I haven't seen anything signed, talking about the suspension of evictions and foreclosures. So for employees who can't make their rent, that's temporarily suspended. It won't absolve them of their penalties. Also, some of the larger banks are offering up to a year of suspended payments. So for people who are worried about making their home loan, some of those things are in place. And California, for example, has already in place disability payments and other short-term leave payments that are part of the state system for employees that they can access at this time. Most of your states on the state labor website have a page specifically dedicated to the pandemic. So you can look there for additional resources, both for employers and for your employees. And it's a good place to keep up to date because literally states pass things daily right now to try and help people work through this along the way. So just be aware that things are changing, and states and even some municipalities may have some additional benefits for employees that as an employer you're responsible for providing. So you just want to stay up to date and keep in touch with what's going on in your state as well as at the federal level.
Well, thank you, Teresa. I think we've hogged our time here. And we'll go ahead and turn over. I'm going to stop sharing my screen. And Demi?
Thank you so much, Mary and Teresa and Alicia. Thank you so much. This was such amazing information. I also would like to mention real quick that with the help of my very good friend Tom Delanzo Baker, we're back up now to 500 people that we can allow on the platform, and they are able now to sign up on Zoom successfully. And Tom also has a very informative webinar of his own starting at 1 o'clock Eastern time today. And Tom, please go ahead and put in the chat line the link for the registration for your webinar. Now, compliance is one thing. But then there are a lot of questions how we can protect our practices financially in an immediate basis. And there are two parameters to it. There is insurance that can protect us, but also there is financial guidance. So we have Ron Rugolo, who will enlighten us on the various insurance options in terms of business insurance and general liability insurance and other insurance products that potentially can be applicable. And right after he gives us his data, we will go to Eric Miller, who will give us data on how we can handle right now the finances of our practice. So Ron, you are on.
Good morning, everybody. Thank you, Dr. Dimitri. I wanted to, Dr. Dimitri asked me to speak about insurance, specifically property insurance as it relates to the virus. It's an unprecedented time. I know everybody's sort of stressed and concerned and looking for avenues in which they may be able to find some sort of financial security, financial backing, or whatever it may be. And insurance, almost all the time, is the avenue that we look to for support in such a catastrophe type situation. I'm going to speak in general terms about a specific property insurance called business interruption and extra expense. That coverage is included on almost every insurance policy for a business or a practice. Business interruption and extra expense insurance is sort of exactly what it sounds like as defined. It will give you the insurance or the financial backing that you would need in the event of a loss that will actually, indemnify you. And that's otherwise made whole by definition, to go ahead and pay continuing expenses. And I'll give you an example. God forbid a building burns down. The building coverage will actually pay for the building or the rebuilding of the building itself. Contents coverage would actually pay for the contents and furnishings, and business interruption would actually pay for what they define as continuing expenses. And that will include things such as rent, mortgage, payroll for key people, and it would also include lost revenue or lost profit. So it's a significant coverage. As it relates to this specific situation, the news and the studies and the reports that we've gotten from almost all insurance carriers nationwide is that this specific event, under the form that it's written, under the ISO form it's written that applies to almost every insurance policy or property insurance policy, is not considered direct physical damage. So in other words, I'll bring it back to that fire. The direct physical damage is obviously to the building, is obviously the fire. In order for coverage to apply for this business interruption, and I'm speaking in very general terms, and I want to stop before I go into definitions and terms and conditions of a policy, and always mention that there's a disclaimer. While this is my opinion as a licensed insurance agent with various designations, I would encourage everyone who feels that they may have a claim to report their claim to their insurance company, because we are not in a position, we're in a position to advise and to give opinions, but we are not in a position to deny a claim. That is ultimately up to the insurance company. So I always recommend, while I give my opinion and I pull apart the policy to show where coverage may trigger, it's always a good idea to put a claim into your insurance company and see how it would reply. So the coverage form, the ISO standard coverage form reads that coverage will apply and trigger to a business interruption loss when there is the presence of direct physical damage or damage to a property. Now, under definition there is not direct physical loss to a property because of an airborne virus. The policy also goes on to read that the cause of loss form excludes coverage for loss or damage caused by or resulting from any virus, bacterium, or other microorganism that induces or is capable of inducing physical distress, illness, or disease. So basically that is a pollutant type of exclusion. The policy also, back in 2006, the insurance companies, I think it was from the H1B1 or one of the other viruses that came along, they instituted a CP0140 exclusion, and it is specific to virus or bacteria, and it's a mandatory exclusion on each and every policy. Furthermore, if there was coverage, which there isn't because it's specifically excluded under a policy, there's a 72-hour waiting period to a business interruption loss. And studies have shown that viruses are typically, or this particular virus is typically living airborne for 4 hours, no more than 4 hours. And furthermore, it could live on surfaces from 1 to 3 days. That happens to be under a 72-hour deductible. So the basically, I just want to mention this in bullet points because I've said a couple of different things. The policy form reads that there must be direct physical loss to the property for coverage to trigger. There's a 72-hour deductible. The pollution exclusion includes a virus. And there's also, furthermore, a virus exclusion under a policy. Now, one of the questions that have come up is what happens if the government shuts down my business? Is that considered civil authority? And there is a specific civil authority mentioned to a policy. Although the issue with business interruption is that the presence of physical damage to the building must still apply. And let's say it's not your building. Let's say it's the next door neighbor's building. If in fact there was some sort of explosion, God forbid, with the building down the block, that's a more appropriate example of civil authority. That means that the authority would come in and shut down your business and building while they were to examine and of course, do an investigation to what caused that explosion. So that is actually when physical damage, it actually reads in the form that there also has to be the presence of physical damage to a building within a mile of your location. Unfortunately, with this virus and with the closing down of the authority requiring the businesses to close down, there is not any presence of physical damage to a building within a mile of anyone's location. Now, I will say that, my presentation is short and I don't have visuals for it only because this is the news and it's fluid. What's interesting is that I just heard that New Jersey is actually, the Assembly of New Jersey is actually trying to introduce a bill into law that would require insurance companies to pay in regard to the business interruption to a business if they were closed down for this specific virus. So I don't know the details of it. I did hear that it does have a financial backstop, so the insurance companies can sort of handle the amount of claims that may come in. Because quite frankly, just knowing the financial size of the insurance companies, I do know, and I'm sure it's a concern in passing any state laws, that they would have a hard time paying each and every business to the degree of the lost revenue. So it's fluid. New York has, the New York State Insurance Department has required all insurance companies to send notice to every policyholder, and that deadline was Friday, to go ahead and write to them as to how their policy would, would apply to this situation. So you may have received that, and you may receive that in the upcoming days. But again, each state, it's a fluid situation. Each state can of course step in as they have done in the past, and mandate insurance companies to do things and override their terms and conditions of their policy.
Ron, thank you very much. And if there are some questions, please type them now so we can ask Ron. It's so amazing that everybody, every time I have a conversation with you about this specific issue, I feel kind of validated from the point of view that I'm saying, yes, we can get perhaps some help from some insurance, perhaps some help from a state government, but really at the end of the day, it is the decisions and the actions that we are taking right now that will drive how our future will be, regardless of anything else. So let me see if there are any questions for you right now.
Yes, I wish I had better news for you guys. It is trying times, so I can appreciate that.
There is a question, was the insurance exclusion that you referred to a CP0410?
Yes, that is correct.
Okay. Is cessation of electricity or internet or other service considered physical damage, especially internet which is being overloaded?
That would have to be actually a covered peril, and that would fall under the mechanical exclusion, wherein something similar to the breakdown of maintenance to a building. So unfortunately, that is not considered direct damage either. More of a fire type wind situation would be a covered peril. So I hate to say interruption to the internet would not fall under there either.
Yep. Thank you. I'm going to be sending my policy to a lawyer in the area to review. They specialize in this. That would be, I guess, a good idea.
Great idea.
I just want to tell you guys, last night, I received an email from the attorney, the franchise attorney we have for hands-on diagnostics. And one of the things that he put in that email was that if you are having if you own the place and you have a mortgage, or if you rent your practice building, there might be provisions in your lease or in your mortgage agreement that may allow you to not pay or delay
Sure.
paying
Yes.
your rent or mortgage. Um, uh, you know, one of our practices where we are involved in a rental agreement. Yesterday, I had a conversation with my brother-in-law who looks quite a bit into finances, and what he suggested was that you could negotiate with a landlord to utilize the security deposit that you put initially to rent the place as a payment, let's say, for the next 1 or 2 months, and then get into an agreement to bank again that security deposit to the amount that it was over a period of time. So a strategy like this might be accepted, let's say, by a landlord, because they will not lose any money. They are going to still make their money. It's just that they will help you to get through this difficult phase by using time as a leverage to get to load up the security deposit again. That's just a suggestion that was offered. All right, Ron, thank you so much. And I would like to bring in Eric Miller from Econologics. Eric, my goodness, the stock market is killing us up and down, right and left. It's kind of a horrible situation there. So
Yes.
should we be panicking, or what should be happening right now?
I hope not. Can you see my slide right now? Or
Yes,
okay.
we can.
Yes. So okay, well, just I'll do a quick introduction. So my name is Eric Miller. I'm the owner of Econologics Financial Advisors. We specialize in working with private practice owners and helping them with their personal finances. And we created a system where we show practice owners how to convert practice profits and turn that into personal financial freedom, creating other income streams, getting out of debt, investing prudently, protecting your assets. So that's where my area of expertise really lies. To answer your question, Dimi, right now, I guess the best word that I can describe the condition that everyone's feeling is simply confusion. And one thing that I know about, and the reason I say that is because in my conversations with practice owners, it's, I don't know if my practice is going to stay open. I don't know how I'm going to pay my bills. I don't know. And when I hear a lot of I don't knows, that's pretty symptomatic of the condition of confusion. So, certainty equals sanity. And when people are uncertain, then it breeds making bad financial decisions. So the first thing that I'm trying to tell clients and other practice owners is that you have to start replacing some of these I don't knows with some kind of certainty. Now, how do you do that? Well, most of us have, and I'm just in watching this presentation, there's so many factors that you have to handle on a day-to-day basis. So, I have a pad and a paper. I write down everything that I have some sort of an uncertainty or confusion about, and I put it all on a piece of paper. And I try to handle one of them at a time, because all I'm trying to handle right now is the confusion of this. And because that's where the destructive decision-making comes into play from a financial perspective. And being a financial advisor for 20 years, I can tell you that when people get confused, they make bad decision after bad decision after bad decision. So that's the first thing that I would really address, is just making sure that you're certain. So how do you do that from a financial perspective? Well, you have to start orienting to yourself of where your money is. How much do you have in the bank? What do you have coming in accounts receivables? These are all things that you have to start looking at and getting certain about. Do you have credit lines? Do you have liquidity? Do you know what your payroll is? Do you know what your expenses are? I mean, the job right now is to make sure that you keep the organization there. That's the main responsibility, is to try to keep the form of the organization there. So, you know, what is that make break number that, you know, that you need to bring in to just keep the form of the organization there? These are all things that I would, you know, I would figure out just to give you some certainty in terms of, you know, where you are from a financial perspective. Another thing too, of course, is looking at, you know, what kind of liquidity that you have. Now, again, you know, do you have credit lines? Do you have, you know, a home equity line of credit? Do you have a business credit line? You know, a lot of people have, you know, investments, you know, either in 401ks or cash value life insurance. You know, there may be some liquidity options there that you need to look at and see if that is something that you can access. But I think, you know, the main thing I'm trying to push is make sure that you start getting certain about your finances. Don't ignore it. Don't like just pass it off to somebody else. Just make sure that you're definitely certain about where you are from a financial perspective. So that'd be my first action. Secondly, would be where you have your attention focused. And, you know, again, I think there's a tendency to start looking 5 months, 6 months, a year from now at what potentially could happen. I think that's a mistake. I think that we have just to start looking at this in 1 to 2 week increments, because there's so much data that's coming out over a period of time that trying to make any kind of financial decisions, or, you know, what I'm going to do with the practice, or when I'm going to start bringing people back, it's just too much. Just looking at 1 to 2 increments. This is 1 to 2 week increments. This is what I have in front of me right now, and this is what I'm going to focus on for the next 1 to 2 weeks. When I get the data, that's good data, then I will analyze that, and then we'll take a look at it and reassess it from that time on. But I wouldn't start looking too far in advance, because I think that's just going to create, you know, more confusion for people. Number one thing you shouldn't do in an economic crisis. Well, you know, I think, Demi, you touched on this. You just can't have the attitude that you're going to succumb. You know, I'm definitely a history buff. I like reading history, and it's interesting that no great movement or organization ever made any significant strides when everything was rich and prosperous. Okay, you make your biggest strides when there is crisis or unrest. And the reason I say that is because I know a lot of us are thinking about, you know, contraction, you know, not expansion. And I think we just have to kind of get that mindset that, you know what, there is definitely something that we can do about it. This is actually an opportunity. And I know that some of the other panelists will probably talk about, you know, adding income streams or marketing opportunities or things like that. But you really, you owe it to yourself, you owe it to your employees to not have that attitude of, you know, we're just going to succumb to this, because that's the collective thought around everyone. So that's definitely the one thing that I would not do. Financially speaking, who should you be connected to? Well, again, you need good information. You don't need to watch the news and watch the stock market, you know, deteriorate down to whatever it's going to deteriorate to. You're not going to get good financial information there. Stay connected to your colleagues, your associations. Definitely get in communication with your accountants, your bookkeepers. These are going to be the people that you're going to depend upon as far as, you know, what your financial scene looks like. Certainly your payroll and your HR person as well, because they'll give you the data that you need in terms of how to handle the employees. Your financial team would include your banker. You know, the previous presenter, you know, I thought that was great. I know it's not really good news in terms of like the business interruption insurance as far as the claims, but, you know, get in touch with your financial team right now and coordinate with them so that you feel like you have your bases covered. I think that's really, really key. A lot of people are just running and hiding right now. I think you really have to make sure that you have your advisors around you so that they give you good information and that they give you, they can help you with making decisions based upon seeing the whole board. I think that's certainly really key. Financial decisions that you should be making right now. I'll give you a couple of things, and again, I'm not trying to scare people because I don't know what's going to happen in terms of like the different financial institutions out there. I do know, being studying history, when there are times of economic distress, there are certain financial institutions that are more prone to what's called systemic risk. Systemic risk is like a breakdown of the system. So when you look at where your money is right now, most people have their money in 3 different financial institutions. You have the depository institutions, which are the banks and credit unions and savings and loans. That's where a majority of us hold our liquidity. They are most prone to systemic risk. So if there's a risk in the banking system, if there's a problem there, that they are most prone. Why? Because banks lend money. That's what they do. Like when you put deposits in the bank, those are lent out almost immediately. And what happens is that if there is a problem with a bank, in times of distress, of course, you're going to see banks fail much more frequently than other types of financial institutions. Now, please, I'm not telling you to go take all your cash out of the bank right now and put it under your mattress. Please don't do that, okay? But I just want to make you aware that is something that you need to evaluate and look at in terms of your the financial institutions where you have a majority of your money. A lot of you have your investments in what are called brokerage or investment companies. These are institutions that are in the business of doing transactions with securities. And generally speaking, brokerage firms, mutual fund companies, these kinds of companies, you don't see the default rate of the company in times of economic distress. But your underlying investments that are held there, of course, are. So, if people have, mutual funds and money invested in the stock market, I mean, the brokerage firm may have a little bit more safety than banks do, but your underlying investments are going to be exposed. Another thing about brokerage accounts is that they do have something called SIPC insurance. So what that means, and it's up to $500,000, that if you have money at a brokerage firm and that brokerage firm goes bankrupt, then there is some protections there, for money there. And again, I'm not telling you to take all your money and put into a brokerage account. Examples of brokerage firms would be like TD Ameritrade or Charles Schwab, or there's definitely different brokerage firms out there. The third type of financial institution that you can potentially look at for housing money would be the contractual institutions. These would be like insurance companies, annuity companies. And these are companies that don't necessarily operate on a lot of leverage. They're not allowed to. They're run by the states, not the federal government. So this isn't a pitch for life insurance or annuities. All I'm saying is that if you're looking for the safety of money, these companies have been around for 200 or 300 years for a reason. When there's these times of economic distress, you don't see insurance companies necessarily go belly up. And, you can convert money into, if you have a cash value life insurance policy or there's different products out there, maybe talk to your advisor on things you can do to protect your money, because I think that's an area that we're all trying to do right now. So, those are some things that you can look at, in terms of personal asset protection, because I don't want to think about the worst. But, there are, I start thinking about like, hey, if people have to like, in financial distress, you have to worry about lawsuits or creditors or anything like that. You really want to make sure that when you look at your personal assets, are there protections around them? There are certain state statutes that protect like your home or your 401ks and your IRAs from any kind of creditor attack. In most states, you know, insurance and annuities are protected from creditors. You know, if you have some kind of a business entity, like an LLC or a limited partnership, there's some protections around them as well. So again, these are all things that in a planning process that you may want to think about in terms of protecting assets that you do have. But you know, I guess, you know, big picture wise, and you know, from our standpoint, this was definitely a wake-up call. You know, over the last so many years, there's been a plan, and we call it the default financial plan. You know, the plan was to create a lot of inflation. The plan was to make the tax code so difficult that people just, you know, ignored it or didn't take advantage of it. The plan was to, you know, make interest rates so low that it was easy to borrow for whatever reason. So people got loads of debt. And, you know, the plan was to, you know, divert money into the stock market so that people can think that they're getting rich when they're not necessarily do it. That was a default plan, and it really worked well. So, you know, getting out of this, which everyone will, because this will pass, you really have to stop and look and say, what are we doing, you know, that would help insulate us in this kind of scenario, you know? And I think that's the big thing that I'm taking out of this right now, is that we have to have a different mindset coming out of this, that you need to have reserves. You need to have money protected. You need to make sure that, you know, you have a profit margin, that there's a spread there, so that, you know, when there is a crunch like this, it's not going to affect you like that, like it does. And we need to make sure that we're out of really, really bad debt. So you have open credit lines, and, you know, you have things that you can depend upon when there are these times of distress. So that's, you know, typically how we advise our clients. And, you know, it definitely woke us up as well to really make sure that we hold people accountable for their financial actions. So that's what I had. Is there any questions that you want me to address?
Eric, thank you very much. This is really awesome information, and helps people to put a little bit of ease in their minds amongst all this craziness that we observe, especially in the stock market. But I mean, I was, Kostas and I were approached by someone the other day and said, oh, okay, how much money did you lose in your 401ks? And in reality, we did not really lose anything. We did not pull anything out, so we did not really lose anything. You lose it when you pull out the money.
Yes.
So
yeah, exactly. Again, this goes back to just making decisions based upon information, not about, you know, impulses or you know, anything else. You know, and I know a lot of people right now are kind of facing because I've had, you know, some clients that have had to shut down, and it's tough, right? And, you know, here's what I do know. You really only lose anything when you don't think that you can create it again. And, you know, when it comes to your business, you know, you only really lose your business if you don't think that you can actually create it again. Most of the people around here that have started a business and have created a business, you know, as long as you have the belief that you can create it again, then you never really lost anything in the first place. And I think that is something that I want to make sure that people understand. And certainly when it comes to their personal finances, it is a bit of a wake-up call that you have to do something different, because this, unfortunately, I don't know, this is the first time that I've seen, you know, we've had economic events in the past. You know, we've had 9/11, and we've had, you know, financial institutions, you know, that have caused stress on the economy. But this is the first time I've seen like where production is shut down for a period of time. So I don't know necessarily what is like, what's going to happen with that, right? I just know that we have to be better prepared. And when we're out of this, we just have to, like, we have to be better prepared so that we can handle this kind of thing.
Thank you, Eric. I appreciate it.
You're welcome.
Thanks so much. So, okay, guys, let's see what we have covered so far. We covered compliance, we covered insurance, we covered finances, and what we're going to be doing right now is we're going to break it up a little bit because we would like to hear from actual private practice owners to get an idea of what specifically they have done to handle the situation. I'm going to bring on my business partner, Kostas Rizopoulos, as well as Bob Bacci, who are private practice owners, and will go over with us what they have done and how they have handled the situation. And right after that, we're going to talk about actual marketing strategies, because I'll tell you this, and I had an amazing conversation with my friend Neil Trickett on that it would be the biggest mistake at this point in time to stop your marketing activities. And we have a few people that will talk about that. We have Neil Trickett, we have Carl Mattiola, from Breakthrough, and we have my business partner, our business partner, Craig Ferreira from Survival Strategies. And then we're going to give you very, very specifics on how to train on telehealth, how to utilize the best platform for telehealth right there, and how you can utilize some other strategies taking advantage of essential medical services so that you can augment your revenue right here, right now. So Kostas, I'm going to start with you first. Just give us an idea of some of the actions that we have taken in our practice, which I have to say, I even have been amazed how we have managed to really take actions that would normally take 3 months, all compacted within less than 7 days. So there you go.
It is one of the wildest weeks ever, not only for us, I guess for everybody. You know, words cannot describe what everybody's going through. And it's very, very interesting that we're going through those technical problems, emotional problems, handling, you know, not only our personal issues, but try to handle our employees' issues and their families. And I don't know, I mean, even my dog's issues, although he's doing fine, has no problems. He looks totally okay. His name is Oliver. You know, one of the things that we have started early on, and I kind of started noticing all this news back in January with China. I started worrying on a personal level back then. And what we did with Dimi, we start kind of getting in some, you know, the Purells and the gloves and the masks early on, kind of anticipating this problem. And one of the things that we started early on again, it was really giving that certainty and sanity to our clients that we're in charge. And more than 3 weeks ago, everything was cleaned, bottom up, you know, going up and down, all machines. Every time something was used, an aide will go and wipe down everything 4 times a day. The whole office will be cleaned from the bathrooms to tables. So that was the first thing we did. And we managed to keep our numbers up to even a few days ago with pretty much like 90% of arrivals. And the beauty with that, it was not only that business was good and everybody was coming in, the beauty was that patients felt very secure. Patients felt that, you know, hey, we are in control. And that's a magic word right there. Who is in control? Is it fear or is actions, right? So we try to introduce to our staff, of course, and to our clients that we are in control. You know, if we follow basic procedure, which is, you know, wash your hands, clean up surfaces, and and keep your distance. And if you don't feel well, stay at home. Those basic messages, you know, it really handle the problem up to a point, of course. Now, obviously, I cannot manage the media, and none of us can manage the media, because the message from the media was totally negative, as we all know, and people start really having second thoughts of maybe, you know, I have to stay at home. Maybe it's better if I don't go for therapy. And so the past few days, we have started realizing a decrease of business as everybody else. And again, I know every state is different in a way. New York and California were like on the top of the list when it comes to COVID-19 cases. So now what we do as a second phase, the second phase that started a week ago, it was that everybody wears gloves, even the patients. When they come in, there are gloves in the entrance, they wear gloves for themselves so they feel secure that when they touch anything, they're not gonna get the virus. We provide masks to our staff at least. We don't provide masks to our patients because we don't have that many. We have just few for us for now, except if the patient doesn't feel very well, so we give them a mask. Again, cleaning everything. Now, in terms of gowns, guys, I don't know if we can buy gowns at this point. I was looking earlier for the gowns. It's like, you know, $5 per gown. I don't know if we can afford gowns at this point.
But can I ask you just for the fun of it, right?
Yeah.
How many gloves do we have in inventory?
I mean, there are thousands of them.
How many thousands? Say it.
40,000 gloves. And again, this is something that it sounds crazy, and maybe people think that I have deprived the system from gloves. But this is, again, from January I've been collecting them, not only for our clients, for the staff. Right now, I give to our staff at least 2 bags of gloves for them and for their families, because a lot of people, guys, as we know, they were not prepared for this. No one foresee what was happening. Again, because I'm from Greece, you know, naturally I communicate with other countries, other colleagues of mine from around the world, and they start realizing this problem more than a month ago. But anyway, so staying now, the third phase, because things are moving so fast, right? I mean, whatever happened an hour ago has changed, or it will change an hour from now. So the next phase, starting Monday, we're implementing the space. You know, we're creating space. Treatment tables are like at least 6 feet apart. Gym equipment are totally spread out in the gym. In terms of our staff, we have started the remote handling of office needs. All the billing department is going to be working from home. Our front desk department is going to do a semi-remote capacity handling of front desk needs. Of course, if you have a voice over IP phones, everybody takes one phone at their home, they connect to the internet, and then they can use the phone the same way you use it as it's inside the office. So this way, most of the supportive personnel stays at home and do business from there. Who stays in the office? Physical therapists, again, protecting themselves with masks and gloves. We might find gowns, gotta look into that. And of course, the part that we're starting right now is the telemedicine. As all of you, I'm certain that all of you are looking into that and try to figure out what's the best way to go about it. And of course, there's not much out there to really grab on and use. In a way, we're developing that new system, you know, as a profession right now. But the message that I want to give you right here, guys, is the following. We are physical therapists, and we're physical therapists for a reason. All of us became physical therapists because we love helping people, right? And again, I know that manual therapy, it's a very important part in what we do. Unfortunately, manual therapy becomes secondary right now. Telemedicine is going to be part of the new reality. Distance, it's what comes in. That's the end result of everything, is that safe distance. So no matter what, whether you touch somebody or not, whether you are on a video call with them or not, or even a phone call or not, you do so much for them by just being there for them. You know that physical therapy is beyond manipulating a tissue. It's more of a manipulating a life, manipulating beliefs, and try to change how they perceive life. And more than ever now, you guys, you are doing a fabulous work, and a very important work, and so let's try, all of us, to keep sanity in our in our, so we can really exercise control with our clients, and give them that feeling of security and certainty.
Thank you, Costa. Also, I would like to tell everyone that this Wednesday at 6 p.m. Eastern, we are going to do a webinar where we will just go through step by step for you guys how we are implementing the TelePT services. We'll go over what have been the challenges, the difficulties, what have we done to overcome them, and what we are planning to do to fully convert the practice in TelePT. And I'm going to bring in right now Bob Bacci, who will just give us some of his perspectives in regards to his practice and what he has done. Bob?
Yeah, thanks, Demi. I appreciate the opportunity to be here today. Interesting times, no doubt. We have been cruising along until Thursday, pretty steady. We did have a small drop-off in the beginning of the week, late last week. It was very insignificant. We were only down 10 visits week over week 2 weeks ago. Everything hit the fan when the governor announced the statewide, it's not a shelter-in-place order, but a stay-at-home order. And we have 2 different facilities, different counties. One county has no cases of COVID-19. The county I'm in has 11. And that news freaked out not only the patients, but our staff in that office. So we've been working to try to get the staff to make a decision. Where do you feel comfortable? Where do you not feel comfortable? Where do our patients feel comfortable? Where then they're not feeling comfortable? And to mitigate that over the past couple of weeks, we put a number of measures in place. We put a sign on the door, said, hey, if you're not feeling ill, if you're not feeling well, please go back to your car, call the office. Let's reschedule your appointment. Unfortunately, we've blown through our personal protective equipment. We don't have any masks. We believe that a number of them disappeared from the office, unfortunately, during this last week. We had plenty in the beginning of the week. We have none now. Cannot get gowns at a reasonable price, as Costa said. Gloves we have. This last Monday, we started to space everybody apart. We went to a meter, and that was easily doable. Our offices are fairly small, 2,500, 2,800 square feet. We see a high volume of patients. So there began to be some discomfort with the staff on the number of patients in the office. And currently, with the limit of 10 in California, I don't know if that's national, but in California, it's 10 at a gathering or 10 at a place at one time. We had more staff than would even meet that need. So everything has been holding up well, as I said. Governor announced stay at home on Thursday night, and yesterday we kind of tanked. We finished up down 1/3 this week from the previous week. We've had some issues with staff. Some of it is fear, obviously. Some of it is lack of protective equipment. I understand that. So we simply went to our staff and said, look, what do you want to do? And interestingly, we have one staff that is continuing to work. and one staff that has decided they would be better off at home. So we have about 250 patients that we need to call between now and Monday for the week and reschedule. We began looking into telehealth a number of months ago. Tried a couple of things, didn't like it. We have a pretty good system. I'm very interested in listening to the webinar this week because we're looking to improve it. But we have a belief with some of our staff, as Costas was talking, that they cannot do a telehealth visit because they can't touch the patient and do the evaluation. And that is a huge issue. And so it's going to be really hard to have a patient start in telehealth if you are unwilling to evaluate them. And we've been working hard with Tom DeLonzo Baker to get them to understand there's a method here that works, that's reasonable, and does get people better. So that is our current challenge today. We've been dealing with that since yesterday. We've run into, and I know everybody has run into kind of an ethical dilemma. I want to say that. I've talked to probably 150 practice owners this last week, and the ethical dilemma focuses around the verbiage of physical therapy being an essential service, and the wording of the Homeland Security that physical therapy plays a part in critical infrastructure to support the United States. So what has happened is physical therapists, not so much in my office, but around the country that I've talked to, say, well, hey, wait. What I do is not essential. You know, if I have somebody in my office that strained their knee, they don't necessarily need to come in and see me this week. And so there's this friction between groups of physical therapists. I'm sure you've seen it, Costas. I'm sure you've seen it, Neil, Carl, you're aware of what I'm talking about, in that you have two opposing groups of, are the services essential? Are they not essential? And there's almost some shaming going on between those two groups to sway opinion one way or another. One of the points that's really interesting to me is there was a lot of talk about physical therapy being primary care, working in federal healthcare clinics, et cetera. I don't see any of that in the last 10 days. It's disappeared from posts that I see. We've got a couple of things we're working on. California has a work share program, which allows us to reduce hours and offset those hours with unemployment. So yesterday, unfortunately, we terminated 15 of our staff. Some of those were terminated because there is not an option on the work sharing program because we don't have the necessary hours to front for them in the office because we're shut down. That is an application that we filed Monday morning. We haven't heard back from the state yet of whether it's accepted, but we're sure it will be. We have reached out to our insurance carrier and say, hey, what do we do? Our policy says that to have coverage, you need full-time work, and we don't have people working full-time now. Fortunately, we have COBRA. Unfortunately, COBRA is very expensive. Thursday, we completed an application. The SBA has an application for natural disaster money. In this case, COVID-19 is considered a natural disaster that falls under economic injury. This morning, since we started this call, I got an email from the SBA that application is being reviewed. I filed it on Thursday. So that, for those of you who do not know, offers low interest loans of 3.75% with delayed payment for up to 30 years, depending on qualifications. So we're looking at that to consolidate some debt, ease that burden from our practice. We have made a number of tweaks. I'll just call them tweaks. Today, we're going to go down and we're going to, as Costas said, we're going to space everything out again. We're going to 10 feet. That is going to require fewer people from a support staff perspective as well in the office. We are planning to implement we're going to eliminate, let me put it this way, we're going to eliminate our reception area in the clinic where we are seeing patients. We are asking patients when they arrive at the building to remain in their vehicle. Call us on the phone, say, hey, you're here for your appointment. We will let them know when it is safe for them to come in so we can manage the number of people in the building. And we're asking them to leave their families. We work in a rural area. There's a lot of, when somebody comes to a physical therapy visit in our clinic, it's not uncommon to bring, the family with them as an outing. It's a cultural thing. So we've had a lot of difficulty clamping down on that because we don't want extra people in the building. So our plan for that is to ask them to remain in their vehicle. Where we go from here, we want to convert to telehealth. We've had some success with that. The problem that we have had was restrictions by the insurance companies, of course, defining what Medicare meant with their e-visits, getting our billing system in sync with all of that. One of the great things that happened yesterday is that the governor of California directed the insurance companies to pay for telehealth at the same payment as an in-person visit across the board, and that includes workers' compensation. So we did talk to several workers' compensation companies yesterday. No one gave us any pushback. I'm not sure they can. As Costas had said, we are moving people off-site. We do have voice over internet phones, so that facilitates that. We have e-fax capability. We have messaging capability through our phone system for our patients. So we continue to evolve, as Costas said, almost hour by hour as things are changing. And that's been really difficult for our staff to understand. They want an answer to a problem now, but we don't have the answer because things are changing so rapidly. So we've been able to keep them fairly calm. I don't fault the staff who feels they should be at home. The problem with this, from my perspective, is it wasn't necessarily well thought out, because every one of the people, every one of the staff, professional staff who have decided to stay home, one of them, husband is a nurse. One of them, two of them are pharmacists. One of them works at a large manufacturing facility, and their plan is to come back in 2 weeks after they sit out and everybody's healthy. But yet in their household, they have people on the front lines who may continue to perpetuate the issue. So when I asked him yesterday afternoon, when everything settled down, is what do we do when we get there? What's going to happen in 2 weeks? They don't have an answer for that. And I don't either, frankly, at this point. But I think it's an ongoing problem. And I'll say this, I have two of my sons who are working at fairly high levels on this issue. One is a vice president of the California Hospital Association. The other is a pharmaceutical vice president. And they're involved in quite a bit of research that's going on. And they have been telling me long before we got to where we are today in California, the United States, that this is going to be a bigger issue, and we're a couple of weeks behind Italy and so forth. Costas, you talk to people from around the world. I think you're hearing the same thing. That's what prompted you to begin to acquire protective equipment. I wish I had been that smart. I left on February, and I went on a 2-week, February 1st, we went on a 2-week cruise. And had I not done that, I might have put 2 and 2 together a little bit quicker, so we had been a little bit more proactive. But I'm sure this is going to pass, probably like a kidney stone, but it will pass. And we're looking forward to we're actually setting up plans as we speak to how are we going to ramp this back up? What is it going to look like? I believe it's forever changed in a lot of fundamental ways. I don't know that I'm interested in having brick and mortar. I'm very interested in telehealth. And as we move forward, we'll see how it all unravels.
Thank you, Bob. This is awesome. And you know, you touched upon something in terms of what we should be looking for the profession, as a profession in general. And for a while now, I've been talking about two major things. If you want, this is my open call to the American Physical Therapy Association and to the PT profession, that there are two major things that can be opportunities for this very moment. One is the complete establishment and reimbursement of full payment for telehealth services, which actually is a step that the APTA is working now. But I'm going to take it a notch up, and I'm going to say the second very vital, but actually not that unrealistic thing to be achieved right now, is establishment of physician status for physical therapists. And I'm not talking about just direct access for Medicare. I'm talking about physician status. Physician status that includes, number one, direct access by all insurances across the country, including the federal regulated insurances. Number two, ability of physical therapists to perform and also to refer for imaging studies. And number three, for physical therapists to be able to prescribe some medications that are not opioids. I'm talking about anti-inflammatory medications, and therefore to be able to have a patient being fully handled by a physical therapist. The training of the physical therapist is nowadays such that fully allows such a status, such a condition, and it will unburden tremendously the healthcare system that is totally overloaded right now. So this is the time for this to be really pushed by our association and by the profession at large.
Yeah, can I just say one thing towards that? We have been working with a large payer. It's actually a large physician group in California since August to try to redefine the model of physical therapy in California. And it's been put on a little bit of a back burner. We're going to finalize things Monday. But that fundamentally changes the way physical therapy is going to be managed with that population. It's 350,000 people. Telehealth is built into the contract. We cannot order imaging, but if we suggest imaging, the physician who is managing the patient or the physician's assistant is going to be required to fulfill our request. We have input on elective surgery, screening patients, using some tools to determine if they're going to be successful or unsuccessful. We're starting with lumbar fusions using a University of Washington tool. It's an algorithm. It's called the back surgery calculator, I believe. So this particular contract is going to affect, hopefully, hundreds of physical therapists in the state. And it's not nationwide, it's not statewide, it's regional in California, but it is moving in exactly the direction that you speak. And we finally found a CEO who was willing to see that vision, driven a lot by outcomes and some other things that we won't talk about now. But he is convinced that this is the right track, and we've got our foot in the door We're also, I'm also a consultant now to that insurance company. So Carl is going to address maybe, and Neil's aware of this concept of call flipping the pyramid. This is probably for me, in the almost 50 years I've done this, the closest that I've ever come to making a major change. So that's really where our focus is long term. We've got this minor problem now, but I think we can make some great changes in physical therapy going forward.
Thank you, Bob. So guys, what I'm going to do right now, I'm going to bring in three people. I'm going to bring in first Neil Trickett, then Carl Mattiola, and then Craig Ferreira to discuss on how you should be putting right now your marketing, PR efforts right in the forefront, and what techniques you should be applying. And then we're going to go into telehealth and other solutions. So Neil, you're on.
All right, great. Thanks, Demi, and thanks everybody for being on here. I think one thing for everybody to really look at is that we have amazing network of people to lean on in these times. We've got great leaders. We've got lots of people from all kinds of aspects of running a practice to help you. So now's the time to reach out. Now's the time to communicate more than ever with colleagues, with network leaders, and use their advice and their tools to help you in your practice through these times. I've actually been through 3 closed down situations in my practice. I went through 3 hurricanes where one of them we were closed for almost 3 weeks, and then recovering from that, from a huge disaster from the whole local economy. And I can say, you know, we're going to get through this. We're going to come out on the other side, and you actually come out stronger. It feels crazy right now. It feels frightening. People are freaking out. But you have to, as Eric was saying, take it day by day, list out the things that you can be at cause of right now. And now is a perfect time to also be looking at what are we going to be doing in the next month, right? We know that if we look at what's happening with China, their businesses are opening back up. Activities are starting to happen again. We're roughly about 4 to 6 weeks behind China. So for me, I'm predicting that by 3rd or 4th week in April, you know, we're starting to have businesses reopen, schools go back, and obviously life is going to be not exactly the same, but we're going to start to recover. So that is, where can you put yourself right now to prepare for that, right? And as Demi was showing right at the beginning, if you don't prepare for that right now, you're really going to hurt your business for the long term, for this whole year. Whereas if you are aggressive right now with your marketing, with your communications to patients, you're going to be much, much more successful as the recovery starts to happen. So I'll just go over a couple of slides here to help you understand this concept and how you can apply it into your business. All right. So the key thing here is, as Eric was mentioning before, everybody's been on today, don't panic, right? Again, I've been through this kind of stuff before where clinics had to shut down and everything. Granted, this is a little bit different, but same kind of concept. But if you can make those smart business decisions now, not based off of fear, you're going to do the right thing for your business moving forward. As Eric was alluding to before, worst business decisions are made by fear and panic. So you really got to be objective at looking at that. And in this time right now, there's a lot of things, a lot of moving parts, but obviously where can you look at to keep your business operating through this next month here? Farm reserves, capital, line of credit, where can you make sure that you've got cash flow happening so that you can survive? It's really essential right now that you fully understand the business recovery curve strategy. This is actually used for emergencies by risk management departments worldwide for Fortune 500 companies, and it's something that you can definitely use in planning for your recovery, and the time to plan for that is right now. And so you're doing the right thing by being on this webinar today, learning a lot about compliance, about financial, about things that you could be doing in your practice to plan right now for your recovery. So as I was mentioned before, again, if we're looking at what's happening with businesses reopening in China, we're going to be there in the next 4 to 6 weeks. And so one thing to kind of keep in mind right now, and I was just talking to a nurse who's a neighbor of mine, is that they've stopped all elective surgeries right now, but those are going to be pushed back. So what happens when they start to do the elective surgeries again in May or in June? And there's going to be also the people that are hurting right now, that have injuries, that aren't necessarily going to the doctor right now. There's going to be a big backlog of people needing your help and services coming up here in the next couple of months. And so is your clinic going to be prepared for that backlog and that need by the public for your help? So in the business recovery strategy, the thing to really look at here is it's a strategy that helps you focus on operational and financial recovery of your business from an emergency. And the concept is very simple. Those businesses which retract considerably on their marketing efforts during an emergency and do not plan for the fastest recovery possible will experience significantly longer financial pain when the recovery happens. Demi showed this perfectly at the beginning in the terms of financial recovery of 2 different clinics. So conversely, those businesses that do plan now and invest in communication and marketing will have a stronger and much quicker return. So here's the concept of business recovery curve. And the goal here is to really look at these 2 different clinics. So both clinics, we're humming along in January. Our emergency happens here, COVID-19. We have that big drop off of revenue and business. And we've got clinic 1 over here that's very proactive. They're working on implementing a telehealth strategy. They're doing what they can to make sure that they have minimized the financial loss as much as possible here this next month. But they also start to really plan for marketing and like this whole recovery that they're going to have coming up, ideally by the end of April. And so what happens is now they start to recover very quickly back to their normal operating basis, so that by, let's say, end of May, June, they're back to a fully operational amount that they were doing. Now let's look at Clinic 2 here. They kind of freak out, they panic, they don't implement telehealth strategies. They retract a lot in their marketing right now. They're not communicating as much to past patients. And so then what happens is when the recovery starts to happen, they have a lot longer time to get back up to that operational. It might take them till July, August, or even later. That whole time they're going to be operating at a loss. So over the course of the year, they're going to have a much greater financial loss than Clinic 1 that was super proactive in what they can do right now to make things keep going and what they can do to recover as fast as possible. So really the goal during the whole crisis is to shorten the length of the financial loss in order to get staff members working again and your clinic producing as fast as possible after that crisis. So here's some actions that you can take right now. One is actually teach your team this business recovery curve so they fully buy into that you're going to have this plan in order to get the business back up and running as soon as possible. You need to really continue to market your practice, but now's the time to really alter your message. Your focus is going to be actually working with the current patients that you've been servicing, with your past patient lists. You need to provide greater value, tips, and strategies. So you need to tweak and alter your marketing message right now. Also, hey, you got to reduce your operation costs as much as possible. Bob was given some good strategies and things he's been doing in his clinic with that. So was Costas. So again, you might need to really look at staffing and operation and cost reduction there. But now's the time to look at what are your contingency plans for starting back up. Let's say things get lifted in 2 weeks or 4 weeks or 6 weeks. What is that going to look like for you, and what do you have in place to capitalize on that as fast as possible? As Eric was mentioning, where can you leverage financial reserves right now? Lines of credit, do you have one? Do you need to apply for one? SBA loans, like Bob was saying. So there's a lot that you need to do right now to get your financial house in order. This is a good time to work on your accounts receivable. So if there's outstanding payments from insurance companies, how can you double the efforts to get that payment in now and improve your cash flow? As Bob was alluding, there's a lot of uncertainty going on with the staff. So now's the time to really communicate with your staff continuously about that recovery plan of action and what is their part going to be in that. We've got some great speakers coming up here about telehealth and virtual treatments. So looking at this, is this a viable option for your practice? How can you make that happen, again, to soften that operational loss? So looking at the main thing here is looking at your recovery that's going to be happening here. So you need to have that preparedness plan ready to go. You need to keep marketing your practice right now, especially to your customer lists. You need to plan substantial marketing efforts to communicate heavily right before you start to reopen again. Again, the natural fear, the natural tendency is to retract. Marketing sometimes is the first on the chopping block in a business. That is absolutely the wrong thing to do. Now is the time to actually double the amount of communication and marketing efforts that you're doing, especially with the right marketing message and targeting more of your current and past patients with that. What can you do to really outflow a tremendous amount of calls, emails, texts? How can you use your staff to help you with that, right? This is going to be really critical so that you can have that rebound occurring really fast. You may need to look at, as you reopen, that staff ramp up plan to utilize key personnel first and scale up the rest of the team. So if you had to scale back on people to hourly or not having people on unpaid leave or whatever it may be, who do you need in first to start delivering care as fast as possible, and then bring the rest of the team in that can help you with your cash flow. This is something I did in my practice, was if you're doing some cash pay payments and things like that, where can you get people as you reopen to prepay for services? So if you can offer like a 6 or 12 visit bundle for a deep discount, yeah, you're getting a discount, but you're getting the cash in now to handle that cash flow that you vitally need in your practice. So just some things to look at there. Ultimately, it comes back to this: outflow equals inflow. If you really understand this concept, you're going to be very successful in this recovery. So in times of emergencies, an incredible amount of communication outflow is needed. And the greater the outflow, the faster the recovery that is going to happen in your practice. And the faster the recovery happens, the lesser the financial loss you're going to experience this year. So this is really for you. We have this whole presentation here, also some tips and strategies right on practicepromotions.net/COVID. I know, we're here to help. Carl's got some great tips and strategies too. So the main thing to keep just focusing on right now is that there is going to be a recovery. It's going to happen probably sooner than we think. And life is going to be a little bit different after that. This is also an amazing time to capitalize on some of the things that we have opportunities for. Damien was pushing there for us having this physician status. That would be absolutely fantastic, a game changer. It's times like this, as Eric was saying, that the really interesting things happen in our lives, right? The outcome ends up being better than where we were before. So I truly believe that. But now is the time to really focus on how are you going to make that happen for your practice.
Thank you so much, Neil. And we have shared part of the handout we gave to everybody includes your presentation. And as you say, we can either choose to, this thing happens, there is chaos, there is panic, and we have a choice to make, to stay in that panic mode that many people unfortunately do, or recollect ourselves and say, okay, good, let me exert control now, let me just start taking some action that I can get ahead of the game. Thank you so much, Neil. And Carl, from Breakthrough, how are you doing, Carl?
I'm great, Demi. Thanks for this. This has been amazing so far.
Awesome.
Nice work
Give us some
putting it
of your
together.
wisdom.
What's that?
Give us some of your wisdom now.
Great, absolutely. So just a little bit about who I am, so you have an idea. I'm the CEO at Breakthrough. Our purpose is to help people in pain get back to normal naturally, so they don't have to rely on pain medication, injections, or surgery that's unnecessary. We believe, as Bob Bocci said, that physical therapy can and should come on the front lines, and that's that concept of flipping the pyramid and putting conservative care first. And that's what we believe, and our goal is to try to put it there. and turn it upside down, because where most of the money flows is into these alternatives that might be unnecessary. And I know a lot of our members are on this call. It's good to hear and see everybody, and I really appreciate you guys for pulling everybody together. We have to be together and stick together during times like this. Yeah, it's incredible. I couldn't be more aligned with what Neil had to say, as well as Eric. Yeah, we need to focus on what we can control right now. And before I get into the stuff that I'm going to cover, I just want to acknowledge each and every one of you on this call as leaders. It's the hardest thing to be a leader right now. You have more demands on you than ever. And I appreciate you for what you're doing to lead your companies, your employees, your team, your staff, and your communities. It's amazing what you guys are doing right now. And I feel you, I'm with you. It's not easy. So cool. Just with that out of the way, I wanted to talk about a couple things here. So first, couldn't be more aligned with what everyone's saying here. This is an event that happened. It's outside of our control, right? It's outside of our control. We couldn't have predicted it, especially going down like it did, right? It's crazy. We need to acknowledge that. But we also need to acknowledge that there's a beginning and there will be an end. And we need to be prepared for when that's over. As well. We need to think about that. And I want to empathize with all of you that right now, you're dealing with a lot. At Breakthrough, we have communicated with thousands of practices virtually since this started. And my team has had one-on-one conversations with over 300 practices at this point. So I've heard a lot of what's going on out there. A lot of people are in different stages. Some people are closing their practices down completely. Others are like Bob, like just starting to go through some of it. And some are still, have seen a dip and have already seen things come back up in terms of visits. So, but I just want to acknowledge that, there is a beginning and an end. It's hard to think about the end when you're in this and you're thinking about it day to day. So the way I think about it is right now it's going to be very tough, and we're going to have to work through some of this stuff day to day. The easiest thing to do is to clinch up and to just shed everything that you're doing, and that's the worst thing you can do. Not just from a marketing perspective, from your whole business. Like, you've built this business up, you do amazing things as physical therapy professionals. You do amazing things for patients, and you shouldn't clinch up right now. Like, now's the time to give value. That's the key for all businesses. You need to give as much value as you can, and it's really your duty to do that, and for your community, even though it's hard. But the easy thing to do is clinch up, and that's what we need to try to instead think long term and have a plan, right? And think about the upside. So personally, take care of yourself and create some space so that you can do that. Now, I'm just going to talk about, I don't have slides for you guys. I didn't have time to prepare that, but I'm going to talk about some of the things that in sifting through and communicating with a huge community of practices have been some of the biggest questions and challenges. The first is how to address your staff, right? And I know you guys might not be expecting this from me, but I just think it's critical, and I wanted to just comment on it a little bit. So you have different people on your team, just like Bob said, that react to this a little differently. And we need to just understand, how do you talk to them when they're certain, their future is uncertain. What we're doing and what we've seen that works well is you have to, first of all, understand what's real, right? Understand what's real in the news. Bob just mentioned some of the chaos that happened after some things are talked about and what's going on with the media. You need to filter that out. Try to not spread the hysteria. Lead with like a steady hand, and communicate with them what's real. Next, we all need to acknowledge that the ground is moving beneath our feet right now, and acknowledge that there's some stuff that's out of our control, but that we need to focus on what we can control. That's probably the most important message of all of this that Eric put out first. Yeah. When you're addressing them, we need to have empathy and understand their situation, but we need to be real about what's going on. And what I've found in these times that works best is to help to channel the energy that they have into things that are productive, and things that you can and should be doing right now that don't cost you a thing, in terms of marketing and just in terms of goodwill, is communicating with your patients. Communicating with your past and present patients as much, however it works to do. Just check in on them and have a conversation and be there for them. So that's one of the things that we're encouraging. I know Chad has his whole team doing that. And yeah, that's one of the things I wanted to talk about. The next thing is in terms of planning. So planning for your business during the dark time, right? So you need to have a plan. You got to hear that Bob's putting a plan together. It's very critical to take the time to do that. And what my business coach and coaches have told me that we need to think about during a time like this is, and even before, which we didn't have in place, and most of you probably hadn't, is to have a plan in a drawer called a gray to black plan that you can pull out during a time like this. So I just want to talk about that, and I'll share how you can get more information on it. There's a lot of, I think Mackenzie put a really great report out on this that I could probably share for you, and some of the stuff that we've put together. But what that is you have to plan for different levels of income reduction over time. One of the easy ways to do this is take your income statement and add a COVID-19 line item to it. And it allows you to have a reduction in revenue in 3 different scenarios, potentially 20% decrease, 50% decrease, and even 100% decrease. And you need to see how long you're going to last and take action, and have a plan for what you're going to do. So, and that will allow you to have a plan to get through today, but plan for the upswing, because the upswing is going to be huge. You guys need to know that we are going to get through this as long as we focus on what we can control, right? And when the upswing happens, we're probably all, if we do that, are going to be in a better place than we were before it happened. And I know for some of you, it may be very hard to think about that. And I feel you, it's tough, but that's the best way to think about it. The last thing is marketing, and I don't need to add too much to what Neil had to say. He basically went through everything that I'm thinking for the most part, big picture. But you can think of marketing like a balloon. You can't deflate the whole balloon right now. If you do that, what's going to happen is people don't even know that you're open, that you still exist, that you will still exist. That's just another way of putting it. You can reduce some spending. I don't recommend it, but you can, but you don't want to stop completely, because what will happen is the goal, it's going to suck right now, but we need to get back to where we were. The goal is to get back to where we were before it happened as fast as possible. In order to do that, we have to keep communications going with our patients. Yep. And so some things I can tell you what we're seeing. We're talking to lots of practices out there in different scenarios. Some are shut down, still marketing, in different ways, communicating directly with their patients. Some are still open. We have some running social distance workshops even in a time like this. and are having success. We have some running virtual workshops that we're testing and working with. We have some also just putting promotions out there for remote consultations, which can turn into telehealth visits or having people come into a private room like some of you guys are discussing. So I'm just putting those things out there as some of the stuff that I'm hearing that's working. Last, I just wanted to share a few things that we can do to help you guys right now. This webinar has been amazing. Our goal at Breakthrough right now is to just give as much value. We believe in physical therapy, and as I mentioned, we want to put it in its rightful spot ahead of everything else for dealing with musculoskeletal issues and beyond that. So our goal right now is to try to pull all the best practices and tips, like everything you're hearing here today, into a spot where you can find it and learn about it. So it's also a place where you can communicate with lots of other owners. We're hearing lots of stories, you know, from owners who are going through hard times that can ask questions and get responses. We're hearing from owners who have been through issues like this before, just like Neil, and have come out stronger on the other side. So you can communicate with those people. So there's two things. We're hosting a virtual event, a big one with a lot of speakers. It's all day. It was initially going to be an in-person event that we had to pivot, but now we're opening it up to everyone for free. I will post the link out to you guys. I can just share it with you in a second, but it is towards the end of April. So if Neil's prediction is right, that things start to swing up in 3 to 4 weeks, the focus of it is on, like, let's get going again. I can't predict what's going to happen, but there's going to be a lot of good stuff there. The last thing is the group, where all of you guys can communicate with each other on Facebook. You can go there at covidptgroup.com. It's a Facebook group where everybody can get together, and I'll post that out as well real quick just for you to see it. It's a place where you can come in. We'll be posting all kinds of stuff for you guys to check out in here. If you want to check out the event, that's free, just to help you through all these things. Really talking about how, hopefully by then, we're talking about how to stand up during and after the crisis. So hopefully that was useful. Any questions for me? I'm here to help. I appreciate all you guys, and Dimi, thanks for pulling this together. It's been amazing.
Thank you, Carl. Appreciate all the tips you gave. Craig, from Survival Strategies, you are speaking to hundreds of PTs every week. So give us some data, and some wisdom from your side.
Great. First of all, see, I don't really exist. I don't have a picture. I just have a name. How's that? At least I'd throw some kind of humor in here, I hope. Listen, yes, I'm talking to folks all the time. Dimi Kostas and I have been working together since the mid-90s. So we're not just business associates, but also extremely close friends. And Dimi, I want to acknowledge you really for putting this together. If we could all clap, we would for you, okay? You've done a great job. I wanted to give you some basic messages. Everyone has brought up all the stuff that I would have brought up myself. Every one of the speakers has brought up things, so I'm not going to get into repetition. But I thought I would just hit a few things that we have also seen. Obviously, there is definitely an end to this cycle. In other words, this thing is going to end. And the only thing that we don't know is when. But what I've noticed is that people are roller coastering. You follow personally. I know this because my consultants who speak to practice owners every day, they get on the phone in the beginning of the call and the person's kind of down, you know, oh, this just happened. I had to let staff go. I'm not making any money. What's going to happen? And then I don't know if you've ever heard of the piece of information called what you put your attention on, you get. It's a great piece of information. So most people put their attention on the problem and the bad news instead of on the creation, which folks have brought up in this seminar today, creating the future, getting to look at the future, not just the present time problem. It's a big, big present time problem. And when folks are stuck in a present time problem, that's all they see. So leadership has to do with stretching through that problem and into the future and creating something that's extremely pro-survival. Now, what's going to happen here, there's a term called toughness. And this group, with the people on this phone and everyone in this profession, and frankly, a whole bunch of other people in other professions, when you get through something like this as a group, you end up to be a lot more tougher at the other side, which is a really, really good thing. So that is going to happen, and it's already happening by you folks being here contributing as it is now. So what is my message back here about this roller coaster that can occur with the folks around you, even with your families? When you see it happen, of course, try to get the attention put on, well, listen, that's step A. Listen to what the person's in, tell me what's happening. Give them some kind of great acknowledgement. I totally understand. Now let's just really get into creating something that we can do something about this particular problem. That's like a drill. That's like a process you could use with anyone around you or with yourself, because I'm sure that this happens with everybody involved. Now, one other additional thing. We've been talking about marketing, but I wanted to throw out something about PR. Now, PR is the step prior to marketing. The sequence is PR, marketing, sales, and advertising. That's a specific sequence. So to help you in your marketing that all the great people on this presentation have brought up, I wanted to just throw in the step before that, which is the good works well publicized. That's the definition of marketing. It's real simple. And the vehicle that you use is third-party endorsements. That's testimonials. Videos, of course, this day is key. You can see I don't have my video. But anyway, so good works well publicized is something that you want to use. Now, I want to give you a story. We were talking to a clinic just the other, I think it was 2 days ago, 48 hours ago, back somewhere, I think in Kentucky, North Carolina, whatever. They've been doing social media for years. And they said what they decided to do on their social media was only put out hope. H-O-P-E, period. They got more response from their social media than they did at any time in the history of their activity. In other words, they were not putting everybody's attention on the problem. You follow how that kind of works. So I thought that was to their patient base. Hope. This is going to change. We are here. We're here to help. This is what we do, the whole bit. And I think, because I don't want to just beat to death what everybody else has already said, those are the things I wanted to put my message out. There is hope. The cycle is going to end. Help yourself and people through the roller coaster. Get your good works, which you produce every day, well promoted. And we're all going to be a lot tougher when this all ends, and that's a good thing.
Thank you,
That's
Craig.
about it, Demi.
This
all right.
is awesome. And it's amazing that we've had already like more than 10 people spoke in this panel, and we have a few more to go. None of the people in this panel since the beginning said, oh my God, this is a catastrophe. What are we gonna do now? None. And this is leadership, looking at doing something about it, finding solutions for that present time problem, and really doing it and helping others. And, you know, I'll tell you, yes, everybody who is in this panel represents some company. But you know something, guys, we are pulling together right now, all of us, not necessarily to make a sale for a product or something, but really genuinely to help, you know, and this is an amazing feeling that I have. You know something, guys, there are 3 different companies right here that just spoke to you, that they are promoting some kind of marketing for private practices. Neil, Carl, and Craig, they all have some sort of competition in the business place, in the marketplace, but they're coming together right now just to give to all of us the knowledge and the tools that we need to get through this. And this is so commendable, and I thank you all for this. We're gonna talk about TelePT right now, telehealth. And the two people that will be addressing this issue is Daniel Seidler and Greg Peters. And I'm gonna start with Daniel first to give us just an introduction on TelePT as a concept. And then we'll jump into Greg Peters, who will discuss with us about how this can be implemented from a platform point of view, and what do you want a platform to have. So Daniel, there you go.
Amy, thank you. And thanks for putting this all together, and all of the speakers that have come already have really taught me a lot, and I appreciate your positive outlook and really forward thinking to be here now and to pass that message along to everybody here. And I've spoken with a lot of you who are on this call already this week, and everyone's really, you're looking for solutions. The fact that you're engaging at this moment and recognizing that we are in a leadership position, I think that's important. And, it's recognized by your staff, your patients, and your community. So you're already, I know you're all communicating with them. I think that's super important at this stage. And because of that, I think it's also very important that you're informed, because we have a lot of the information in terms of, particularly telehealth and what's going to be allowed. And man, the laws are changing on a daily basis. I think everyone's recognizing that. Telehealth laws were already changing pretty fast. And then when this all came along, things really accelerated. For example, 18 states have changed their telehealth laws or written caveats into their coverage, into how insurance has to cover telehealth. Some of it applies to PT, some of it does not. Mary and Teresa talked about how the Medicare CMS 1135 expansion, how that has changed for PT and being able to do e-visits. I think that was really helpful, Mary. You made it very simple. There's a lot of information going on there about the 1135 expansion and using those G codes. And PTs need to understand that those are e-visits, they're not telehealth, but it is an opportunity for us to engage with our patients. So I think that's really important right now. In addition, just a few more resources, just so you have them. I think everyone should be looking to the APTA, look at PPS. They do have reliable information. They're trying to get their information out as fast as possible. And when there are changes, they do update them. So I think they're doing a great job. I also rely on the Center for Telehealth. I'm sorry, this is CTEL, the Center for Telehealth and eHealth Law. Very good source that is advocating for telehealth. And I'm communicating with them. I've connected them with the APTA. And we will be speaking with people in Washington about getting telehealth much more involved in some of the changes that are happening on a national and state basis. And the last one, great resource for telehealth, is the CCHPCA, Center for Connected Health Policy of California. And they do nationwide research and get information out that's very applicable to PTs. So check them out, cchpca.org. There's updates on a daily basis at this point, information about Medicaid, information about commercial payers, all the changes that are happening. They're documenting it, they're getting it out, sign up for their newsletter, updates, all that stuff. Very helpful resource. So, and when you have that information, please communicate it clearly and effectively to your people. I think, that shows leadership, shows authority, and I think that's really important at this stage. So I was a practice owner for 15 years. I've worked with DME over that time. We did a lot of advocacy for the profession and DME and COSAS. So that's why I really appreciate being able to work with them at this point when people really need us for leadership and guidance. So thank you guys for involving me here. So for you folks, practice owners, everyone's talked about it already, get your plan together. And I'll refer specifically to telehealth. Have a plan, all right? You normally when I do a launch for a telehealth group, and that's what I do now. I'm a consultant helping PT practices get their telehealth practice up and running. make it successful for the long run. And we're typically looking at long-term plans. Right now, we need to all take a breath, as I just did, and also look at the short-term solutions. Telehealth is a pretty good Band-Aid for this moment. So I want you guys to all think about that. Think of the short-term solution and how you're going to launch right now and do it as efficiently and effectively as possible without being too much of a distraction to everything else going on in everybody else's life, right? So do get that short-term solution going, but also be looking for the long-term. Be planning for that long-term. And Neil and Carl, you guys alluded to that. And there will be a return. Things are going to come back, and you're going to be ready. If you're running when things start coming back, and everyone's not going to come into your office at the same time. People aren't going to all decide to start coming back into your office at the same time. They're going to ramp up slowly. So they're still going to want those telehealth services. A lot of people are still going to want those telehealth services, and gradually people will start trickling in more and more. In addition, I mean, this is a huge opportunity to build out a telehealth after a forest fire, for example, there's new growth after. There's new growth. This is new growth for you. There's an opportunity to plant those seeds and create new growth for your practice. So right now it's a short-term solution, but be thinking about telehealth as something that can really be part of the growth of your practice over the long run. And there's so many models to do it. There's so many opportunities. I'm not going to get into any of that stuff right now. Sorry, I'm talking fast. I actually, I have another call coming up in a couple of minutes, so I want to get through as much as possible. And I do have a couple of slides. I'll share them real quick. Let's see if I can share my screen. There we go. So the big things that are happening for everybody are we're trying to figure out how to connect with our patients, right? Now, recognize that telehealth is something new for most PTs and most patients. It's not something that many have done before. So there was a lot of pushback before. Now there's less pushback because this is an opportunity for us to connect, obviously, but still be sensitive. This is new. This is new for providers and patients. They still have their hesitancy and their fears and their discomfort with all of it. And we have to help them through that. So I expect each of the practice owners, each of the leaders to understand what you're getting into, understand what it is to be a telehealth PT, and practice it yourself, engage and do it yourself too, okay? And help them through the emotional part of it. They'll get the technical side of it. Help them through the emotional part of it and the understanding and wrapping their head around the fact that they're not going to be touching their patients if they're treating them remotely. And there's plenty of techniques out there. There's plenty of approaches. It's really important that you're as PTs, you're very sensitive to the fact that you're not going to be touching the patient, and the communication has to be very clear, concise, direct, and in both directions, okay? Now, the most important thing as far as technology goes, I think most of our practices are set up pretty good to carry on a telehealth visit, and I'm not going to get too into that. I mean, you decide what you want to use. The biggest challenge and frustration in telehealth that I've experienced and seen is a poor connection. Now, right now, this has been perfect, right? Perfect, but we've all been on conference calls and webinars and other telecommunication, video calls and stuff like that, where things go sideways. So it's really important that you minimize from your side what can possibly go wrong technically. So use a high-powered computer. Make sure your internet is as strong as it needs to be. I typically recommend over 100 Mbps download, over 10 Mbps upload. Greg might be able to correct me on that if we need to be more powerful, but you should be using the best equipment on your side. And your patients, as far as your patients go, same to them. Let them know. They can, with most platforms, they can use a phone, but it's better if they're not using a phone, better if they're using a tablet or a laptop or a desktop. So think about that and help them out with that. Let them know in advance. I recommend wireless headphones with microphone, earbuds, or some sort of Bluetooth device, Beats, so that patient can move around, they can hear you, and you can hear them. That's it. That's all I'm going to say on that. If they are using a phone or an iPad, they should have an adjustable stand, because you're going to want to see their whole body. They'll probably be back 4 to 6 feet in most cases, unless you're doing, look, you typically, when you're in a room with a patient or in a gym with a patient, you see their whole body, and you want to see as much of their body as you can. You want to see them move. Even if they're doing shoulder exercises, you want to see if they're extending their spine, or they're overexerting, or they're compensating, right? So you want to see as much of them as you can, have them back 4 to 6 feet, and you still want to be able to hear them and be able to interact with them. So that's where the headset's going. Lastly, I said Wi-Fi. I think that's super important, that they're, they shouldn't be doing this in a Starbucks. Not many people are in Starbucks these days, but they also shouldn't be out in the park. You could try it, but your Wi-Fi, your connection is probably going to be off, and it's going to be frustrating. So make sure they're in a quiet room. A lot of people are home with their families right now, right? They're sheltered at home, or kids are home. Have them shut the door. Make sure the family understands that they need 30 minutes of private time. They need to be able to engage with you, and it should be fun, but they need to be engaged with you one-to-one, not treating their kids, not pushing the dog away, not watching TV at the same time. This is a PT visit, okay? If you schedule a PT visit with them, 30 to 45 minutes, get them engaged with you. And it's going to be different. It's going to be a little intense. It's going to be, it's very one-on-one, and use that for what it is. Get value out of that, but set the expectations before the visit. This is some stuff about the provider technology. Like I said, you can use a laptop or a desktop. You might want to use a webcam and a microphone. That's really the clearest way. You're not going to be moving around too much, maybe doing some demonstration of exercises, but some of the platforms out there actually offer exercises built in, which is nice. Most importantly, communicate clearly. And, well, actually, most importantly, be a good listener. That's where our value comes in as PTs, particularly through telehealth. You're not using your hands. You are speaking and demonstrating a lot, but most importantly, pay attention to your patients. They're telling you a lot. You're not in the same room with them, so things are a little bit different, but you're one-on-one, and they'll talk to you. They'll open up to you if you allow them to. Okay. Let's see. Research your platform before you just go right into it. Don't just take your buddy's recommendation. It really needs to be something that's good for your practice, and know what you want out of the platform. Do you want bells and whistles? Do you want to just connect? Most importantly, the only deal breaker, I think, for a platform is connectivity. It has to be easy for you to get on. It has to be easy for your patient to get on, and the platform needs to not drop you or either of you in the middle of the session. Anything can happen as far as connectivity. It can be part of the hardware, but the platform needs to not be part of the problem. And here are a couple of tips. Here are a couple of things that you need to have for every visit. HIPAA compliance has been relaxed, but I still recommend you get written consent for a telehealth visit. Use a HIPAA compliant platform, even though the regulations have been minimized or waived for now. I still recommend you do it. Get used to it. Get on a good platform that works right, that is meant for telehealth. It will set you up for the future. This is a good time to do that. Check your hardware and connectivity. I said that before. If you need authorization from your provider, check eligibility, check your authorization. This is a physical therapy visit, non-Medicare. Those are e-visits. Mary and Teresa talked about that. We're talking about authorized visits where you're billing an insurance company. Get your authorization, check your eligibility. It will count as a visit. Make sure you have access to your EMR, whether you're home, and your PTs, if they're treating from home, they're going to need access to their EMR or records. They need to be prepared before the visits. Particularly at the beginning, I recommend scheduling visits a little bit longer than you expect the visit to be. So if it's a 30-minute slot, if it's a 30-minute visit, schedule for 45 minutes, buffer that extra 15 minutes just to get your learning curve up, get your patient's learning curve up, recognize your patients are going to have problems doing this. You're going to have some challenges, but you're going to get through it. It just might take a little bit more time. So have a treatment plan together. If you're going to use streaming videos, great. Know where they are. Know how to research. Know how to search them in your platform. Some people are using their home exercise programs also. So get your MedBridge out. Get your other exercise programs out. If you're using written home exercises, awesome. You know, screenshot them or take a picture with your phone and text them to your patients. Have them ready in advance or follow up afterwards with your home exercise programs, and know how you're going to get paid. Okay, this is different. You may not have somebody in your office taking payment for your telehealth visits, and your providers, some of them might be treating from home. How are you getting paid? Partly insurance, partly cash. So know how you're going to collect cash. If there's a co-payment, how are you going to collect the co-payment? Have a system in place. And you know, maybe use a Stripe, maybe use a PayPal, maybe you go through your office system and EMR, however but recognize that it's not going to be the normal flow where someone walks up to the front desk and gives you a credit card. You're going to have to account for how you're going to get paid. Let's see if I have anything else. Oh, this is, lastly, recognize that this is an opportunity, okay? Many people have never done telehealth before. Providers haven't done telehealth before, but it's an opportunity to demonstrate the value of telehealth, to demonstrate that value to your staff, to your patients, and to the overall community and to our payers, okay? If we do this right, if you learn how to be a great telehealth practitioner and you can be effective with your patients, which any good PT should really be able to bring value through telehealth visits. That's going to really carry over for the long run. It's going to normalize telehealth as a treatment option. It's going to, and it's going to make it, patients will actually come to you for telehealth visits. So you're going to be the leaders out there who are actually the ones who have the early adopters, first generation telehealth providers. And you guys are going to be the leaders in this field, particularly in the PT space. So use this opportunity to create your space in telehealth. Lastly, when you get on camera, you're ready to do your first visit, and encourage your PTs the same thing. Remember, you're on camera, okay? So you're being viewed much like a session like this. Don't be fixing your hair or fussing the whole time. You know, recognize that you're being observed. And Dimi's laughing at this. We had a whole conversation about this. Like, you know, don't poke at your nose and whatever else. Be aware that people are watching you through this whole thing. It's one-on-one. And most importantly, smile, relax, and be helpful for your patients. I think I'm passing this on now to Greg. Greg's at Better PT. They're a great platform, so easy to use. I encourage you guys to, if not use it, at least check it out. I think you'll like Better PT. Greg, take it away.
Dan, thank you. Dimi, thank you. I just want to say, and I've said this on every webinar I've spoken on, this is the greatest community of people in the world because they are true peers. And I don't think that is something that you can say about any other industry, especially in healthcare. And so as we're all going through this, and I think everything that I would say has been said as it relates to opportunity and kind of where we are, but I'll kind of give you two thoughts. One is the world is round. We are at the bottom right now, but we're going to be back at the top at some point. And so we have to always keep in mind that we're on our way, and we're not really sure where the bottom of the world is yet, but we're getting close. The second is that the sum is greater than the parts. Everyone coming together, competitors in different softwares or marketing companies, everyone coming together to help this industry is what I'm most excited about and I'm most proud to be a part of. And I think that that's going to continue, and that's what's going to drive the success and the paradigm shift that was spoken about for PT being the first stop. So I just wanted to say that. The second part is I am the CEO of Better PT. Better PT is a platform technology company. We focus solely on access. How do we improve access? And the genesis of Better PT was about modernizing the industry and trying to help people bring their practice into the 21st century. I never imagined that we would be catapulted into the modernization in just a very short amount of time. So what I'm here to talk about is really the telehealth solution that we have, Better Telehealth. But I also, regardless of our product, I want to give everyone out there some things you need to think about when evaluating a product. One, make sure you are acknowledging that you have to go and find some solution, right? That Dan has mentioned, Demian mentioned, everyone's mentioned. But two, understanding that the message to your patients that you're actively pursuing a solution is so important. They need to know that you're going to have an option for them and that you're in the process of finding that option so that you can, one, deal with the current state of the union, but two, going forward, they're going to be part of your patient and have a service offering that I think is going to be the future of this industry. So let's talk about the use. Dan talked about connectivity. So let's talk about the real difficult part of telehealth. It's all about connectivity. It's about user error, as I call it. My team calls it. You know, my screen is gray, my phone dropped, and then you talk about kind of where we are in the world, where we're all at home. We're all eating up all this bandwidth. So in the next 6 weeks, everyone's going to have some challenges with connectivity. But as long as best practice is presented to the patient and the provider and the administrator, right? I think everyone will minimize that connection issue. But that's something that we've worked hard on, is just giving best practice. Two, nobody here is an expert at telehealth. No one. Maybe Dan is. Maybe Dan is. He tells me he's an expert. But ultimately, everybody has had 25 to 30 years experience probably on this call. You're an expert. You have more than 10,000 hours of treatment, putting your hands on people. I don't believe anybody on this call has probably more than about 5 hours of telehealth, telehealth experience. I don't count FaceTime with your family. That doesn't count. So when you look at the curve and the steep learning curve we're in, this is the opportunity. It's the opportunity for you to jump into something that you don't understand yet. It's an opportunity to create new programs, new protocols, new evaluation structures. It's an opportunity to find new workforce, right? We all have the young generation. I'm young, but I have younger people in my office. Remote is the way of life. So how do we provide these people the tools so that they can still do the thing they love to do, and how can the business benefit? This is what telehealth and telemedicine platforms can do for a company. So I encourage you to manage your expectations. This is going to be a steep learning curve, but it's going to happen. You're going to get to where you need to be. So let's talk about platforms. First and foremost, you need to evaluate HIPAA compliance. Dan had mentioned there's a lot of leniency on what you're able to use. Think of this as a long-term solution. So you have to have HIPAA compliance. Two, it has to be stable. Dan mentioned stability. You have to find a tool that's stable, that can handle scale, that also has the ability to grow with you as a partner, right? Technology companies can't just be another line item. They need to be part of your growth, your strategy to the future. So find a company, a tool that you feel that your feedback is going to be heard, and the feedback is also going to be reflective in the iterations of the product and the service. So I encourage you to do that. Find a platform. Find something that doesn't just do telehealth. Find something that can also provide some other tool or service that also modernizes your practice and builds efficiency to the back office. Platforms that are interoperable, right? Before this crisis, we call it, interoperability was the topic of every conversation, every webinar. What's this word, interoperability? It's just the ability for systems to talk. It's the ability for you as a practice owner to identify a value in a software that's going to help your practice and be able to plug it into your EMR or to the other platforms that you're using. So again, this is actually a time to shop, right? At this very moment, you want to shop, but you also want to have something that you can get off the ground fast, right? Something that's easily to deploy, something that doesn't require a massive workflow adoption, but it also is easy and convenient to use for both the patient and the provider. I encourage you all, if you ever downloaded an app or had to download software, imagine now that you're going to ask your patient who already has tremendous anxiety and is in pain to sit there and try to figure out how to download an application, put all their information in, and actually now get on a visit with you and take care of themselves. It's really cumbersome and it's a really big ask. So I also encourage you to test the model of convenience and efficiency for those connections. Same with the provider, right? Is that not only does the provider have to perform the visit and actually do the work, they don't want to be left to download an application and find the right software. That's also challenging. So again, be really thorough in your evaluation of the tools that are out there. Flexibility of the product. Like Danny mentioned, there's a whole bunch of products out there, bells and whistles. I don't know if anybody knows what they need yet. So really look at the simplicity of the product. Look at the time horizon of, I have my visits, I'm down 10%. In 2 weeks, I'm going to be down 50%. What can I do now to try to cut that in half? And if you find a solution that's easy to deploy, that you can be trained on, and you can start to use it, you're going to be way ahead of the game. And then all of a sudden now you're chipping away at those 10,000 hours and you're getting close to being an expert. So again, I think keep things simple. I really believe in simplicity. I really believe in staying in your lane and doing what you do. And I really think that I'm really proud of the practice owners that we've deployed. We've deployed over 1,000 clinics at about 7 days. And I think it just speaks volumes about the willingness of the practice owner to force change and also to get in front of this and communicate with the patients and the providers that this is an option and they need to know it's an option and that they're there for everybody to maintain some sense of order until this comes back. And as everybody has outlined, when this comes back and you're ahead of the game, the opportunities will be far greater than you've ever seen. You will be a more efficient practice, you'll be a more mindful practice, and I think you will find that your growth will be exponential for future. So I know everyone's been on this call for 3 hours. I am going to stop, and I'm going to, again, send my gratitude to Dimi and everybody else that's been on this panel, to all the practice owners. This is just a moment in time, and we'll all look back at this and go, hey, do you remember when we were on this call on Saturday and there was so much positivity, there was so much learning going on, and look where we are today. And we are the focus of the world. We're the focus of healthcare. We're the focus of treatment. We're the focus of reimbursements, because we can all sit here and say we have not been treated well. We've been treating well, but we have not been treated well as it relates to reimbursements and the rest of the outlook from some of our peers in healthcare. So Dimi, thank you.
Greg, thank you very much. And let me just say that this coming Wednesday, and I put it on the chat, I will be doing with Costas together at 6 p.m. Eastern, a special webinar where Costas and I will just go over with you the very specific steps that we have taken to convert our practice to TelePT, as well as the pitfalls, the mistakes that we were making, mistakes that we realized that we were making just yesterday, but the planning that we have on changing those mistakes. And by the way, let me tell you something. We used to be open 5 days a week. Guess now how many days are we open? With the consensus of our physical therapists, we are open 7 days a week, delivering telehealth services from 7:30 a.m. until 8:30 p.m. Eastern Standard Time. Okay? So I'm going to talk to you about that on Wednesday. And guess what? We were delivering services in the state of New York just since last week. Guess what services we are delivering right now? We are delivering services in New York, in New Jersey, in Pennsylvania, in Maryland, and in Florida. 5 different states overnight. So I'm gonna go over all this stuff with you guys when you join us at the meeting on Wednesday. But what I would like to share with you right now, I'm gonna go back to the original slide that I showed you, that you can have a practice that will choose a slow path to recovery, where they will not even get to the point where they were before, even after a whole year of operations after COVID-19, or you can implement mitigation strategies, and many of those we really covered in this call, and I'm going to cover another one right now, in getting to a much, much better place than before. So now, here is, I'm going to show you this slide. I'm going to explain to you what I mean with this, and then I will go over a couple of details. So look at this. This is a practice before COVID-19, right here. This practice is making, let's say, $100,000 or a little bit more than $100,000. Now, during COVID-19, what do? They are implementing TelePT services, and they're implementing outside business of diagnostic testing. So now, instead of making $100,000, yeah, maybe they are making like maybe 80 or 90 or something like that. But they have now established these two new lines of businesses. They have established the outside diagnostic business that I'm going to go over this, and they have established the TelePT already. So these businesses now will be add-on businesses to the recovery after they get through COVID-19. All right. So here is what I'm talking about. By implementing diagnostic testing of electromyography and diagnostic ultrasound, not necessarily only inside your practice, but in physicians' offices. Now, in some states, physical therapy practices have been shut down for two reasons. Either because there was some determination by your specific legislators, governors, or whatever, that you are not essential medical business, or because your patients are not coming anymore. You know why? Because somebody who says, okay, I have a back pain or a neck pain, or I had a knee arthroscopy, they do not really consider physical therapy as a life-saving treatment. They don't consider their back pain as a life-threatening condition. But their diabetes is life-threatening. Their heart disease, their hypertension, they are life-threatening diseases. And that's why they continue going to their internal medicine and family practice, primary care physicians, or their endocrinology doctors. So what do you do then? You go and you deliver diagnostic testing services like EMG and ultrasound where the patients are. If the patients are in those physicians' offices, you make agreements with those physicians and you go and you deliver services to them. And I'll tell you, in terms of our practice right now, yes, as Kostas told you, there is a decrease in our physical therapy visits, significant decrease in the actual office visits. There is even some small decrease in our diagnostic testing, the one we did in-house or the one we did, let's say, in an orthopedist office. But the diagnostic testing that we do in offices of internal medicine doctors, family medicine, endocrinology doctors, they are still high at numbers. So we are able to continue drawing revenue from that activity. I'm going to show you some specific stuff. What are the ways you can deliver the service? You can deliver the service as an in-house business, meaning inside your practice for the number of patients that you have, and that specific service will yield to you reimbursements 5 to 10 times more than you make from a PT visit. Let me use this example. Let's say that you used to have a practice with 20 new patients a week. That practice generated 300 appointments, let's say, a week at $97 a visit. That's the national average as per PPSAPTA. You have an income, let's say, of $29,000 per week. Now, if you lose 10% of those new patients and 10% of these weekly visits, then your new income will be half of it. 14,550. So you have a net loss of half of the money. Well, if you add it now, diagnostic testing for this group of 50% that they remained as patients in your office, and you did a few EMGs and neuro ultrasounds, a few actual joint ultrasounds, and some evoked potentials, you can recover a significant amount of money from the in-house diagnostics, and it will make your net loss inside your office, in this case, from 14,550 to just 6,500. Like, you're gonna end up losing, instead of half of the money, you're gonna end up losing 30% of the money. But it doesn't have to stop there. I talked about outside business. You can go and deliver the testing in physicians' offices, podiatrists, chiropractors, other PTs, and medical centers. The average reimbursement per hour to deliver these services in those centers is $300 per hour, okay? So what does it mean now? What is the new picture? Let's say that you went and you delivered 3 days a week, you or your staff, in those physicians' offices, in those medical centers, these services, and you got $300 per hour, because the physician is billing the insurance company, the physician makes the money. So the physician pays you $300 per hour for delivering these services. That would be a gain for you of $7,200 per week. Let's put the numbers together. If you made $8,000 from the in-house diagnostics in your practice, and you made $7,200 a week from outside business diagnostics, then if your past income was $29,100, guess what? Despite the fact that you are getting a 50% reduction in revenue because of the coronavirus, the additional revenues you are getting from diagnostics will bring you with a net effect zero. You are gonna make more actually than you were making before if you follow this recipe, if you follow this strategy. So this is basically another alternative that you can use to telehealth and to anything else you can think of that will help you get this picture, that will help you mitigate right now your loss and actually bring you in a much better position in the future for the post-COVID-19 environment. So, and this is basically what I wanted to share in terms of additional have you been able to see my slides, or you haven't been able to see my slides? Yes?
We can see it.
No, we could see him, Demi. We could see him. Yep.
All right. So I am going to open up now to any questions that you guys have for anyone on the panel. Any questions that you may have. Yes, we have shared multiple times the handouts for the presentations, and we're gonna make sure that, guys, we're gonna email those presentations to everybody, and you can tell your friends that they can go in 2 hours from now to COVID19PTforum.com, where they will be able to find this entire presentation, the recording of this presentation. All right, regarding the legislation to relax HIPAA security, was there an end date on that rule? We can have, I don't know, both Greg and Daniel are not here. Mary is here, she can answer to that. But what I will tell you is this, okay? And again, this is my interpretation. When I am reading the language for the relaxation of the HIPAA compliance, the relaxation for the HIPAA compliance is for telehealth providers. Physical therapists for Medicare, they are not really considered yet as telehealth providers. They are getting this e-visit, but not as regular telehealth providers. So for me, why really go through something unsafe? Why be in trouble in the future? And why utilize something now that in a month from now, when HIPAA will be back in place, you will have to change it all over. Get a platform from now that is HIPAA compliant and use a HIPAA compliant platform, period. What telehealth programs have you reviewed and any recommendations? From our side, if you go to www.teleptforme.com, we are using basically 3 things. We are using, number one, the implementation training by Daniel Seidler. We are using Greg's platform, the Better PT platform. And if you go, guys, to handsonseminars.com, we have available now for you an actual course which teaches you how to conduct a whole session. It's a certification course for TelePT. It teaches you basically how to establish a session with a patient, what special tests to do for different joints, for cervical, lumbar, upper extremity, lower extremity, what special tests. There are videos, there is an exam at the end. It's a really great course that you can find it at handsonseminars.com. Any other questions? Did you make any adjustment in your service charges for telehealth visits? The answer is no. We charge the same amount as we always charged. We don't make a change. Of course, now with Medicare, that would be different there, but in terms of the other visits, no, we do not charge anything different. All right, any other questions? Okay, I would like to thank so much the panelists who participated in this and all of you that patiently and with the challenging technology we had, you stuck with us. So thank you so much. We'll see how things are going, and we'll do in the near future another panel discussion like this. And of course, we invite you in Wednesday's webinar on TelePT. Once again, thank you so much. Keep going. There are solutions to this. Something can be done about it. And taking a drastic action right now will put every single one of us in a much better place in the near future when this is all done. So thank you all and take care.